You open your eyes. The world is a soft, blurry watercolor of white and pale blue. There is a gentle, rhythmic beeping somewhere to your left, a steady companion in the quiet. A nurse's kind voice floats down to you, asking a question you don't quite understand. You feel a dull throb, a deep and distant ache from somewhere in your body, but it's manageable. It's muted. The pain is there, but it's behind a thick wall of medication. You remember being wheeled into a bright, sterile room. You remember a mask being placed over your face, a voice telling you to count backward from 10. You might have made it to 8. You remember nothing else. Nothing of the knife, nothing of the procedure that saved you. You were given the gift of oblivion, a temporary, merciful darkness. Now, I want you to imagine something very different. Imagine there is no oblivion, no gentle slide into unconsciousness. Imagine you are awake for all of it. Every slice, every cut, every grating saw of bone. Imagine the operating room is not a sterile sanctuary, but a wooden theater slick with the blood of those who came before you. Imagine the only mercy you are offered is speed. This was not some dystopian nightmare. For almost all of human history, this was the reality of surgery. This was the price of survival. Welcome to the dark, historian. Get comfortable. Dim the lights. Slow your breathing. Let the world outside fade away. Let the sounds of your room become distant, and allow your mind to travel back with me. Back to a time before the quiet peace of anesthesia. Back to a world of noise and terror and pain. To understand this world, you have to first erase what you know. Forget the clean, quiet hospital. Forget the gentle care, the hushed voices, the careful management of your comfort. We are going to the early 19th century, a time of great change, of steam and iron and burgeoning cities. But in the world of medicine, it was still an era shrouded in a profound and terrifying darkness. Think of a city from that time, London or Paris or Boston. The air is thick with the smoke of coal fires and the smell of unwashed humanity. The streets are a chaotic symphony of iron-shod wheels on cobblestone and the cries of street vendors. Life is loud, and often it is short. A simple infection from a cut could be a death sentence. A broken bone could lead to a life of disability or worse. The human body was a mystery, a fragile vessel at the mercy of fevers, plagues, and accidents. And the doctors of the day, for all their best intentions, were fighting a war with weapons of superstition and incomplete knowledge. They believed in balancing humors, in miasmas, in bad air carrying disease. The idea that invisible creatures, germs, were the true enemy was still decades away, a notion that would be met with scorn and ridicule. In this world, surgery was not a cure. It was a last resort, a desperate final gamble when all other options had failed. It was an admission of defeat. When a doctor told you that you needed an operation, it was not a message of hope. It was a conversation about mutilation. It was a discussion about enduring an agony so profound that it bordered on the unimaginable, all for a slim chance of living. Many people, when faced with this choice, simply refused. They chose to die with their bodies whole, to succumb to the gangrene in their leg or the tumor in their breast, rather than face the conscious horror of the knife. Who could blame them? The stories were whispered in every tavern, in every parlor, stories of the screams that could be heard from the street outside the hospital. Stories of men who died on the table, not from the procedure, but from the shock and the pain alone. So, When you were told you needed surgery, a profound dread would settle over you. A cold, heavy stone in the pit of your stomach. You would say your goodbyes to your family. You would make your peace with your God, because you knew, with chilling certainty, that you might not survive the ordeal. And even if you did, you would be changed forever, haunted by the memory of it. Let's walk, you and I, into one of these early hospitals. Don't expect the scent of antiseptic cleaner. The first thing that hits you is the smell. It is a thick, complex, and utterly foul odor. It's the smell of unwashed bodies crowded together in poorly ventilated wards. It's the smell of sickness, of sweat-soaked linen, of chamber pots left too long, and underneath it all, a coppery, metallic tang. The smell of old blood. It's a smell that clings to the wooden floorboards, to the plaster on the walls, to the very clothes of the people who work here. The sounds are just as jarring. A low, constant murmur of moaning from the wards. A chorus of suffering, a man coughing, a deep, rattling cough that speaks of failing lungs, a woman weeping quietly in her bed. And then, from behind a closed door at the end of the hall, a sound that cuts through everything else, a scream. It is not a cry of simple pain. It is a raw, animal sound of pure agony and terror. It is sharp, and then it is cut off, muffled, as if a hand has been clapped over a mouth. The other patients in the ward fall silent. They know what that sound means. They know that behind that door, someone is on the operating table, and they pray they are never the one behind that door. This is the atmosphere you would wait in. For hours, sometimes days. You would lie in your cot, listening to the sounds of the hospital, smelling the air thick with disease and fear, knowing your turn was coming. There was no pre-operative sedation to calm your nerves. There was only your own racing heart, the cold sweat on your skin, and the terrifying images your mind conjured of what was to come. Finally, your time arrives. Two large, burly men, hospital porters, come to your bedside. They are not unkind, but their faces are grim set. They've done this 100 times. They help you to your feet and guide you down the hallway towards that dreaded door. Every step is an act of will. The screams you heard earlier are gone now, replaced by a grim silence. The door opens, and you step inside the operating theatre. The word theatre is quite literal. In the great teaching hospitals, the operating room was designed like a small amphitheatre. Rows of wooden benches rose steeply from a central space, allowing students and visiting physicians to observe the procedure. Imagine that. Your most vulnerable, terrifying moment is not a private affair. It is a public performance. Dozens of eyes are on you, watching with a mixture of academic curiosity and morbid fascination. They are here to learn from your suffering. The room itself is often located at the top of the building, where the natural light is best. There are large windows, but they do little to dispel the gloom of the space. The centerpiece is the table. It is not a sterile, padded surface. It is a simple, sturdy wooden table, or perhaps a large, reclining chair covered in worn leather. It is stained dark with the blood of countless patients. Scratches and gouges mar its surface, testament to the struggles of those who lay there before you. On the floor, you see a wooden bucket filled with sawdust. Its purpose is sickeningly clear. It is there to absorb the blood. A small table stands nearby, covered with a piece of cloth. On it are the tools. They glisten under the light from the window. They are not the delicate, precision-milled instruments of today. They are heavy, brutal-looking things, long, sharp knives of various shapes and sizes, saws that look like they belong in a carpenter's workshop, probes, hooks, and forceps that seem more suited for torture than healing. And they are not sterile. They may have been wiped clean with a rag after the last operation, but they are teeming with invisible bacteria. The very tools meant to save you are just as likely to kill you with the infection they introduce. And then there is the surgeon. He enters the room with an air of grim authority. He is not here to comfort you. He is not here to hold your hand. He is a man valued for two things above all else: his knowledge of anatomy and his speed. A good surgeon in the pre-anesthetic era was a fast surgeon. The less time you spent on that table, the less time you had to endure the pain, the less blood you lost, the better your chances of surviving the shock to your system. The most famous surgeons were like rock stars of their day, their speed legendary. Men like Robert Liston, who could reputedly amputate a leg in under 3 minutes, from the first cut to the final stitch. The surgeon barely looks at you. He speaks in low tones to his assistants. He is preparing himself mentally. This is not just a physical ordeal for you. It is a psychological one for him. He must steel himself against your pleas, your screams. He must become detached, a machine of flesh and bone, moving with brutal efficiency. To hesitate, to show pity, would be to prolong the agony. His speed is his only expression of mercy. You are helped onto the table. There are no soft restraints. The hospital porters, the same men who brought you here, position themselves. One holds your arms, the other your legs. Their grips are like iron. Another assistant stands by your head, ready to hold you still, to cover your mouth if your screams become too distracting. You are pinned, immobilized, a living sacrifice on the altar of medicine. You look up at the faces of the students in the gallery, a sea of pale, curious onlookers. You look at the surgeon, who now picks up his first instrument. He might offer you a swig of brandy or whiskey, a pitifully small comfort against the coming storm. He might place a leather strap between your teeth for you to bite down on, to keep you from biting off your own tongue. He looks at his pocket watch, perhaps nodding to an assistant to time him, and then, without another word, he begins. The first touch of the cold steel on your skin is a shock, and then comes the pain. It is not a simple pain. It is an all-consuming, blinding, searing reality. It is a white-hot explosion in your mind that obliterates all other thought. There is no past, no future, only this horrific, eternal present. Your body arches against the hands holding you down. A scream tears from your throat, raw and broken. The world dissolves into a red haze of agony. You can hear the surgeon's calm, focused instructions to his assistants, a surreal counterpoint to your own desperate cries. You can hear the wet, tearing sound of the knife moving through muscle and tissue. You can feel the grating vibration as the saw bites into bone. The smell of your own blood fills your nostrils. Time ceases to have meaning. Seconds feel like hours. Minutes feel like an eternity. You might pass out from the pain, a small, fleeting mercy, but you will be woken again by a fresh wave of it. The porters hold you firm, their knuckles white, their faces strained. They are not immune to this. They have seen it all before, but it never becomes easy. Even the students in the gallery, who began with detached curiosity, now look pale. Some may have to turn away, unable to watch. This was the experience, This was the grim crucible through which a person had to pass for a chance at life. And this ordeal was not limited to the poor in charity hospitals. It was the same for the rich in their private homes. Wealth could buy you a more experienced surgeon, a cleaner room, but it could not buy you freedom from the pain. King or commoner, when you went under the knife, you went under it wide awake. Think about the types of operations performed. Amputations were the most common, a grim necessity for crushed limbs or rampant infections like gangrene. The surgeon would cut a flap of skin, pull it back, slice through the muscle down to the bone, and then take up the saw. The sound of that saw, the high-pitched shriek of metal on bone, was a sound no one ever forgot. After the limb was severed and tossed into the sawdust bucket, the surgeon would have to tie off the arteries. He would use hooks to pull the squirting vessels from the bloody stump, while an assistant sponged away the gore. Then the skin flap would be sewn shut, often with the hot iron of a cauterizer used to sear the wound and stop the bleeding, adding the smell of burning flesh to the already horrific scene. But it wasn't just amputations. Surgeons would remove bladder stones, a procedure called a lithotomy, which involved cutting through the perineum to access the bladder. They would remove superficial tumors and cysts. They would set broken bones, the crunch of bone being forced back into place a sickening sound. They attempted early forms of eye surgery, trepanation of the skull to relieve pressure on the brain. Each one of these procedures, which today we consider routine, was a bespoke form of torture, a unique and personalized hell, and the surgeons themselves, they were a strange breed. To succeed in this world, you had to possess a very specific set of characteristics. You needed nerves of steel, an unshakable confidence, and a profound emotional detachment. You had to be able to look at a screaming, writhing human being and see only the anatomy, the problem that needed to be fixed. Many were seen as brash, arrogant, even callous. But perhaps this was a necessary armor. How else could a person do this job day after day, to inflict such suffering in the name of healing without going mad? They carried the weight of every patient they lost, every scream they caused. Their hands, though stained with blood, were often the only hope a person had. They were both butchers and saviors, angels of mercy with the tools of a torturer. This, then, was the world before the silence, before the peace of anesthesia. It was a world of profound and constant fear when it came to the surgeon's knife. A world where the cure was often as terrifying as the disease. The operating theatre was not a place of healing. It was a place of brutal, desperate struggle. A place where the boundaries between life and death, between medicine and violence, were terrifyingly thin. It was a world waiting for a revolution. A world desperate for a way to quiet the screams. And the story of how that silence was found is where our journey will take us next. But first, we must sit for a moment in this uncomfortable reality. We must understand the depth of the darkness to truly appreciate the light that was to come. The dread was real. The pain was absolute. And for now, in our story, it is the only world there is. It is a world made entirely of a single, terrible truth, a truth that blots out the sun, silences the birds, and chills the warmest room. For the person about to go under the knife, this truth is not an idea. It is a physical presence, a predator waiting in the next room. So what do you do? What do you do when the doctor, a man of science and grim pronouncements, has left your home, his footsteps echoing down the hall, leaving behind a silence more profound than any noise. He has told you the options, or rather the option: an amputation, the removal of a stone, the cutting away of a tumor that is slowly, inexorably killing you. He has explained that without the operation, death is certain, but with it survival is only a possibility, and the cost of that possibility is a journey into a hell of pure sensation. You are left alone with this knowledge. The first thing that happens is a strange quiet in your mind. The world shrinks. The concerns of yesterday, the price of bread, a spat with a neighbor, the mending that needs to be done, it all evaporates like morning mist. There is only the before and the after, and the terrifying bridge of pain that connects them. You look around the room, the familiar chair by the fire, the worn rug, the portrait of your parents on the wall, their faces stoic and serene. They seem to be from another world, a world without this kind of choice. How do you prepare for an appointment with agony? It's not like preparing for a journey or a wedding. It is a preparation of the soul. You must first, before all else, prepare to die. This is not pessimism. It is pragmatism. The surgeon himself may have told you, the shock of the pain alone can stop a heart. The loss of blood can drain a life away in minutes. And even if you survive the table, the laudable pus they believe is a sign of healing can turn to gangrene. Infection, the invisible killer, stalks every operating theatre. So you do not hope for the best. You prepare for the worst, and that preparation begins with paper and ink. You find yourself at a small wooden desk. Perhaps it is late at night. The rest of the house is asleep, blissfully unaware of the task you are undertaking. A single candle sputters, casting long, dancing shadows that make the room feel alive and hostile. You pull out a clean sheet of parchment. It feels impossibly smooth, impossibly final. You dip the quill into the ink pot. The scratch of the nib on the paper is the only sound. It sounds like a shovel digging into dry earth. You are writing your last will and testament. Think about that. You are not an old man, frail and expecting the end. You might be a young woman with a diseased lung, a soldier with a shattered leg, a father in the prime of his life with a stone in his bladder. Yet here you are, dividing your worldly possessions as if you were already a ghost. What do you write? The words feel clumsy, inadequate. To my beloved wife, Mary, I leave the house and all its furnishings. How can that sentence possibly contain the years of shared laughter, the warmth of her hand in yours, the private language of a long marriage? It can't. It is just black ink on a pale surface, a legal formality for a world you may be about to leave. You think of your children. To your son, Thomas, the set of woodworking tools his grandfather gave you. You can picture his small hands, how they will one day grow to fit the smooth wooden handles. You hope he will learn the trade. You hope he will be a good man. You write a line, a piece of advice. Be honest and be kind. Your hand trembles. Is that all you have to give him? The sum of your fatherly wisdom boiled down to 5 words on a legal document. To your daughter, Elena, your late mother's silver locket. She is too young for it now, but one day she will wear it. Will she remember you? Will she know the face of the man who gave it to her? Or will you become a story, a portrait on the wall, a whispered name? The thought is a cold stone in your gut, a pain entirely separate from the one you are scheduled to meet. You list the small things, the family Bible to your brother, a few coins to a loyal servant. The act of writing it all down is surreal. You are cataloguing your own life, turning memories into assets. Each object you list conjures a ghost. The rocking chair where you soothed your crying infants. The set of books you saved for months to buy. The worn coat hanging by the door, the one you wore through a dozen winters. You are methodically dismantling your own existence, piece by piece. And with every scratch of the quill, you are accepting, in the most profound way, that you might not survive. This document is your final footprint on the earth, your last act of control in a situation where you have none. You sign your name at the bottom. The ink is still wet. It glistens in the candlelight like dark blood. You sprinkle it with sand to dry it, then fold the document, the creases sharp and definite. You seal it with wax, pressing your signet ring into the warm, soft pool. The emblem, your family's mark, is now a tombstone. Once the practicalities are done, the truly difficult work begins. The goodbyes. How do you say goodbye to the people you love when you are not going on a journey? When you are, in fact, simply going to a room in the next street over? How do you look your child in the eye, knowing the next time they see you, you might be a cold body laid out in the parlor? You don't. Not really. You cannot tell them the whole truth. It would be too cruel. So you perform a delicate, heartbreaking dance. You pull your son onto your lap. You tell him to be good for his mother. You tousle his hair, trying to memorize the feel of the fine strands, the shape of his skull, the innocent trust in his eyes. You hold him a little too tight, a little too long. He squirms, wanting to go and play. He does not understand the desperation in your embrace, and for that you are grateful. It is a small mercy. You speak with your wife. You sit together by the fire, the sealed will a silent accusation on the mantelpiece between you. You don't talk about the surgery, not directly. You talk about the future, about the children. You make plans you may never see fulfilled. A trip to the seaside next summer, the daughter's wedding years from now. It is a fantasy, a shared fiction you both cling to, a way of pretending that tomorrow is just another day, but the truth hangs in the air between you. You see it in the way she looks at you when she thinks you are not watching. A flash of pure, undiluted terror. You see it in the way she touches your arm, her fingers tracing the veins, as if trying to commit your living form to memory. You speak of trivial things, but your eyes are saying everything you cannot. I love you. I'm scared. Please, don't let me go. Forgive me for what I must do. Forgive me if I do not return. There are letters to write as well. Not legal documents, but personal ones. A final letter to your wife, to be opened only if the worst should happen. Here, you can finally be honest. Here, in the solitude of the late-night study, you can pour out the fear and the love you have held back. You tell her how you felt the day you met her. You remind her of a shared joke, a secret memory. You ask her to be strong for the children. You tell her not to mourn for too long, to find happiness again. Every word is a small death. Every sentence is an admission of failure. The failure to stay, to protect, to grow old with her. You write to your parents. To a dear friend, you try to impart some meaning, some final lesson from your life. But all you can think about is the raw, physical reality of what is to come. The image of the knife, the saw, the blood. It intrudes, a visceral flash of red against the black ink. You push it down. You have to. You have to finish. These letters are your ghost. They are the only part of you that will remain if your body is broken on the surgeon's table. Then comes the final night. Sleep is impossible. Of course it is. How could you sleep? Every time you close your eyes, you see it, the operating theatre. Not the clean, sterile room you might imagine today. No, you picture a cramped room, perhaps an attic or a converted lecture hall, wooden floors stained dark with the blood of countless others who came before you. A single table in the center, a skylight above, casting a cold, dispassionate light on the proceedings. You imagine the smell, a coppery tang of old blood mixed with sweat, fear, and the unwashed bodies of the spectators who will crowd in to watch your ordeal. You imagine the sounds, the murmur of the crowd, the clatter of iron instruments on a metal tray, the surgeon's calm, detached voice. You lie in your bed, and your body betrays you. Your heart hammers against your ribs, a frantic drumbeat counting down the hours. A cold sweat slicks your skin, even under the thickest blankets. You shiver, but not from the cold. It is a tremor that starts deep in your bones, a physical manifestation of pure dread. You pray. You may not be a pious man, but on this night you pray with a fervor you have never known. You pray to a God who feels distant and cruel. You bargain. You plead. Let this cup pass from me. Give me the strength to endure. Let me live. Please, let me live to see my children grow. Let me feel my wife's hand in mine one more time. Your prayers are not eloquent. They are the raw, desperate cries of a cornered animal. The hours crawl by. Each tick of the grandfather clock in the hall is a hammer blow. You watch the moonlight creep across the floor, a slow, silver tide marking the passage of time. There is no escape. The dawn will come, and with it, the surgeon. Morning arrives, not with a gentle glow, but with a harsh, grey finality. The birds are singing outside your window. How can they sing? How can the world go on with its ordinary business, its cheerful sounds, on this day of all days? It feels like a personal insult. You are told not to eat. An empty stomach is better, they say. Less chance of vomiting during the procedure. The thought of food is sickening anyway. Your throat is tight with fear. You might be offered a drink, a stiff glass of brandy or whiskey, liquid courage. You gulp it down. It burns a trail to your stomach, a false warmth that does little to quell the icy dread. It only dulls the edges of your terror, making the world feel slightly blurry, slightly unreal. You get dressed. You choose your clothes carefully. Not your finest suit, but something simple. Something you don't mind being ruined, because it will be ruined, soaked in blood. Your blood. The act of buttoning a shirt, of tying your shoes, feels like a ritual for your own execution. Then comes the knock on the door. It is time. The goodbyes are a blur. A final, desperate kiss for your wife. Her face is pale, her eyes wide with a terror that mirrors your own. A hand on your children's heads. You can't look at them. Not now. If you do, your resolve will shatter. You will beg not to go. You will weep and cling to them, and that cannot happen. For the patient in this age, there was a strange and terrible code of honor. You were expected to be brave, to face the knife with stoicism. Society, and the surgeons themselves, prized the patient who did not scream too much, who did not struggle. It was a matter of pride to endure it well, so you must put on a mask of calm. A fragile, paper-thin mask that you fear will crack at any moment. You walk out of your home. The cool morning air feels strange on your skin. The familiar street, The one you have walked 1,000 times looks alien. The faces of passers-by, a baker carrying a tray of fresh bread, a woman sweeping her stoop, they seem like figures in a dream. They are living in the real world. You are already in another realm, a waiting room between life and death. The journey to the surgeon's house or the hospital is the longest journey of your life. Every step, every turn of the carriage wheels is a step closer to the table. You might try to distract yourself. You might count the cobblestones or watch the clouds. But your mind is a traitor. It keeps returning to one image. The glint of polished steel. You are acutely aware of the part of your body that is to be cut. The leg that throbs with a dull ache. The abdomen that feels tight and swollen. It is a part of you. It has been with you your entire life. And in a short while, a man you barely know will take a knife and cut it away. The violation of it is almost as terrifying as the pain itself. The idea of being held down, conscious and aware, while your own body is methodically deconstructed. This entire process, from the moment of diagnosis to the knock on the surgeon's door, was a psychological ordeal designed to break a person down long before the first incision was ever made. It was a period of sustained, relentless mental anguish. You are not just preparing for pain. You are being unmade. Your identity as a whole, healthy person is stripped away. Your role as a father, a husband, a provider is put on hold. You are reduced to one thing, and one thing only. A patient, a collection of flesh and bone and fear about to be offered up to the god of the knife. And as you arrive, as you see the door, as you hear the muffled sounds from within, you take one last, deep breath of the outside air. You try to hold on to the feeling of it, the smell of the city, the sensation of being whole, because you know, with a certainty that eclipses all else, that the person who walks through that door will never be the same person who walks out, if they walk out at all. The preparation is over. The agony is about to begin. And so, in the center of that hushed and fearful room, all eyes turn to the door. The patient is bound. The assistants are braced. The moment has arrived. Through that door walks a new kind of man. Not a healer in the way you might imagine one today. Not a scientist in a sterile coat, speaking in hushed, reassuring tones. No, this man is something else entirely. He is an artist, but his medium is flesh and bone. He is a craftsman, but his work is subtraction, not addition. He is, above all, a performer, and the operating theatre is his stage. This is the pre-anesthetic surgeon, a figure born of necessity, forged in the crucible of agony. In his world, the gentle hand, the careful stitch, the patient exploration of an ailment, these are luxuries that do not exist. They are fatal indulgences. In his world, there are only two virtues that matter: speed and strength. Think about it. When your only tool to manage a patient's suffering is the speed at which you can end the procedure, then your entire profession becomes a race against the clock. Every second that ticks by is a second filled with screaming. Every moment of hesitation is a moment that can send a patient into the black abyss of surgical shock, a state from which they might never return. So the man who walks into that room is not celebrated for his intellect or his delicate touch. He is celebrated for the brutal, shocking, and life-saving swiftness of his hands. He is a blur of motion, a force of nature. His reputation is built not on papers published in medical journals, but on whispers in the street. Did you hear about Dr. So-and-so? Amputated a leg in under a minute, removed a bladder stone in 50 seconds. A living legend. And strength. You need to understand the kind of raw, physical power this required. There are no power tools here. There are no sophisticated retractors to hold a wound open. There is only steel and wood and the muscle of the men holding the patient down. The surgeon himself had to be an instrument of force. Imagine sawing through a human thigh bone, the femur, the largest, strongest bone in the body. Imagine the resistance, the grating, shuddering vibration that travels up the saw into your arm and rattles your very teeth. You cannot be gentle. You cannot be hesitant. You must apply consistent, overwhelming force, driving the blade through with the power of your entire body. You must be strong enough to hold your line, to keep the cut true, even as the person beneath you thrashes in unimaginable pain. You need the strength of a butcher, the stamina of a blacksmith, all concentrated into a few terrifying moments. This was the ideal, the archetype, and like all archetypes, it had its ultimate expression in one man. A man whose name became a legend in the hospitals of London. A name that promised both the best chance of survival and an experience of pure, unadulterated terror. His name was Robert Liston. To understand Liston, you have to picture him. He was not a small man. He stood 6'2", a giant in his era. He was famously impatient, famously abrasive, and possessed a theatrical flair that captivated his students and terrified his patients. He moved with a kind of restless energy, a man who seemed to be in a constant hurry. And he was. He was always in a race against pain. When Liston entered the operating theatre at University College Hospital, a change came over the room. The air crackled. The students in the viewing gallery would lean forward, craning their necks. They knew they were about to see a master at work. A violent, bloody, but brilliant master. He didn't wear scrubs or a mask. His uniform was a simple set of street clothes, perhaps a waistcoat, covered by a large apron. An apron made of heavy canvas or rubber, stiff and dark, with the dried blood of 100 previous operations. He wouldn't wash his hands. Why would he? They were only going to get bloody again. Instead, he might run a hand through his hair or adjust his collar, and then turn to the task at hand. His tools would be laid out, not a delicate tray of shining, sterile instruments. These were tools of a different philosophy, heavy, bone-handled knives. A large, wicked-looking amputation saw, its teeth sharp and ready. Thick needles and waxed ligature to tie off the arteries. He would often hold his favorite knife, the one he used for the initial incision, between his teeth as he positioned the patient's limb, freeing his hands. The glint of steel held in a grimacing mouth was often the last thing a patient saw with any clarity before the pain began. Liston's famous catchphrase, bellowed across the theatre to the students, was "Time me, gentlemen, time me." It was a challenge, a boast, a promise of the terrible velocity to come, and he delivered. His most famous procedure, the one that cemented his legend, was a leg amputation. Think about what that entails: cutting through skin, then fat, then muscle, sinew and tendon, tying off the arteries as they spurt blood, and finally sawing through the bone itself. A modern surgeon, with all the benefits of anesthesia, blood transfusions, and advanced tools, might take the better part of an hour. Liston did it in 2.5 minutes. From the moment the knife first touched the skin to the moment the severed leg was tossed into the sawdust-filled box below, less time than it takes to boil an egg. Let's walk through that blur. Imagine you are in that gallery, looking down. The patient is on the table, held fast by several strong men. Liston grabs the limb. He is not gentle. He positions it exactly as he needs it. The knife, which was in his mouth a moment before, is now in his hand. There is a flash of movement, a single, fluid arc. He cuts down to the bone in one sweeping motion. The patient's scream is instantaneous, a sound that is not quite human. It is the sound of a soul being torn. Before that scream has even finished, an assistant has a tourniquet tight on the major artery, but Liston is already moving. The knife is discarded, bloody, and the saw is in his hand. The grating begins. It is a horrifyingly loud sound, a wet, tearing, rhythmic rasp that fills the entire room. Sawdust, bone dust, and a spray of red mist fly into the air. Liston's entire body is thrown into the effort, his fine coat splattered with gore. The students are silent, mesmerized. The assistants struggle to hold the convulsing patient. The sound of the saw changes pitch as it breaks through the final section of bone. A sudden, sickening crack, and then silence. Or rather, the sawing stops. The screaming does not. Liston, without breaking his rhythm, takes the limb and with a final cut of his knife, severs the remaining flesh. He tosses it aside. A thud. The leg is gone. Now the final, crucial part. He works with blinding speed, using needles and thread to tie off the blood vessels, the gushing arteries, before the patient bleeds to death on the table. He works by feel, his fingers moving with a sureness born of 1,000 such procedures. He packs the wound, applies a crude bandage, and then he stands up straight. He looks at his stopwatch. 2.5 minutes, gentlemen. He has saved a life. But in the process, he has inflicted a trauma so profound, so elemental, that the patient, if they survive, will be forever changed. This particular surgery became a part of medical folklore for an even darker reason. In his haste, Liston's flashing knife work was a little too enthusiastic. As he brought the knife up after the first incision, he accidentally amputated the fingers of his young assistant, who was holding the patient's leg. The assistant, like the patient, later died of sepsis from the infected wound. And that's not all. During his wild, soaring-up stroke, the blade also slashed through the coattails of an elderly spectator in the gallery. The old man, believing he had been stabbed in a vital organ, collapsed and died of fright on the spot. It remains, to this day, the only known surgical procedure with a 300% mortality rate. This story, while extreme, tells you everything you need to know about the priorities of the time. Precision was secondary. The well-being of the assistants was secondary. The shock to the onlookers was irrelevant. All that mattered was getting it over with. Speed was God, and Robert Liston was its high priest, and his tools were the instruments of this brutal faith. Let's look closer at them. You have to understand, these were not the light, elegant, disposable tools of today. These were personal instruments, often carried by the surgeon in a velvet-lined wooden case. They were his companions, an extension of his own hand. The amputation knife was not a scalpel. It was a long, curved blade, sometimes a foot long or more, designed to cut through the entire diameter of a limb in 1 or 2 strokes. It was sharpened to a razor's edge, but it was heavy, weighted for power. The saw was often a frame saw, similar to what a butcher or a carpenter might use. The teeth were coarse, designed to rip through bone quickly. They didn't leave a clean surface. They left a shattered, splintered mess that was prone to infection. But it was fast, speed over cleanliness, speed over a good outcome for healing, speed over everything. Then there were the other tools, the forceps for extracting musket balls, the trocar, a wicked-looking pointed rod used for draining fluids from the body, the lithotome, a specialized and terrifying instrument for cutting into the bladder to remove stones. Each one was an object of pure, unadorned function. There was no attempt to make them look less frightening. They were what they were, instruments for a controlled, violent dismantling of the human body. And the surgeon, this wielder of brutal tools, wore his experience on his very clothes. That blood-caked apron was not a mark of shame. It was a badge of honor. It was a resume. It showed you were a busy surgeon, a man in demand. The more blood, the more experience. The idea of washing it between procedures would have been seen as bizarre, even eccentric. The concept of germ theory was still decades away. The invisible world of bacteria was a fantasy. The only dangers they understood were the ones they could see: bleeding, shock, and the patient dying from sheer pain on the table. So the surgeon would walk from one patient to the next, carrying the blood and tissue of the last person on his hands, on his tools, on his coat. He was an unknowing angel of death, spreading infection with the same hands that were trying to save a life. But what must it have been like to be that man, to be Robert Liston, to stand over a conscious human being, to look them in the eye, and know that you are about to inflict the worst pain they will ever experience, a pain so absolute that it might kill them, to hear their pleas, their bargains with God, their final, desperate screams, and to do it anyway, day after day. It required a kind of psychological armor that is difficult for us to comprehend, a willed detachment from the suffering you were creating. You had to see the person on the table, not as a person, but as a problem to be solved. A faulty machine to be fixed. The leg is the problem. Remove the leg. The tumor is the problem. Cut out the tumor. The humanity of the patient, their fear, their agony, it was a distraction, a dangerous variable that could make your hand shake, could make you hesitate. And hesitation meant death, so they became performers. They adopted a persona of unflappable confidence, of almost callous indifference. Liston's booming voice, his theatrical timing, his challenges to the students, it was all part of the armor. It was a way to manage the horror of the situation, for himself as much as for anyone else. By turning it into a spectacle, a contest of skill and speed, he could perhaps distance himself from the raw, human misery at its core. He had to believe with every fiber of his being that the terrible, violent thing he was about to do was better than the alternative, that a few minutes of hell was a fair price to pay for a lifetime of relief from a diseased limb or a festering wound. He had to see himself as a savior, even as he wielded the tools of a torturer. This was the paradox of the pre-anesthetic surgeon. He was both a hero and a monster, a life-saver and a butcher. He stood at the absolute pinnacle of his profession, a respected and often wealthy man whose entire career was built on a foundation of screams. His strength was a celebrated virtue, his speed a thing of legend, his blood-stained coat a symbol of his mastery. This was the man you prayed you would never have to meet. and if you did, you prayed he would be fast. Very, very fast. But we have only seen this from one side of the knife. We have stood with the surgeon in the relative safety of the viewing gallery. We have timed him. We have marveled at his speed. But what about the person on the table? What was it like to be under that knife? To be the raw material for this brutal art form? To understand the true darkness of this era, we must leave the surgeon's side. We must lie down on that wooden table, feel the bite of the leather straps on our wrists, and look up into the cold, determined eyes of the man who is about to save our life by taking us apart. You look up, and the first thing you see are the faces. Dozens of them. They are arranged in a circle, rising in tears, a wall of humanity looking down at you. Some are young, their expressions a mixture of academic curiosity and thinly veiled horror. Others are older, their faces impassive, weathered by sights like this before. They are all strangers, and they are all here to watch you be taken apart. The light is poor. It comes from a high window, perhaps, or a gas lamp, casting long, dancing shadows across the room. It catches the glint in a man's spectacles, the sweat on another's brow. But it doesn't reach you. You are in the center, in the pit, on display. The room is not a room, not in the way you understand it. It is a theater, an amphitheater built of dark, worn wood. The benches are steep, almost vertical, so that every single person has an unobstructed view, a perfect view of you. You can hear their whispers, a low, continuous hum that buzzes just at the edge of your hearing. You can hear the rustle of their clothes, the scrape of a boot on the wooden floorboards, the occasional cough that echoes in the high-ceilinged space. This is the operating theater, and it is not a place of quiet healing. It is a place of public spectacle. Let's stay here for a moment on this table. Let your eyes adjust to the dim light. Look past the faces and see the structure itself. The wood is dark, stained by time and perhaps by other things. It rises up and around you, a dizzying bowl of polished grain and deep shadows. In some of the grander hospitals in London or Paris, these theatres were marvels of architecture. Great domed skylights were built to flood the central stage with as much natural light as possible, because every detail of the procedure needed to be seen. Every cut, every stitch, every drop of blood. This wasn't about privacy. It was about education and reputation. The men in the highest, cheapest seats are the students. They are young, eager, and they have paid for this lesson. For them, you are a living textbook. Your body is the map they need to learn. They crane their necks, jostling for position, notebooks in hand. They are here to watch a master at work, to memorize the precise angle of the saw, the swift, confident movement of the knife. They are learning how to save lives, and the price of that education is your agony. They try to be clinical, to see you not as a person, but as a problem, a puzzle of flesh and bone to be solved. But you can see it in the eyes of the younger ones, the fear, the empathy they are trying so hard to suppress. They know that one day it will be their hands holding the instruments. Below them, in the better seats, sit the other surgeons, the colleagues and rivals of the man who stands over you. They are not here to learn the basics. They are here to judge, to critique, to admire. Surgery in this age was a performance art. A surgeon's fame was built on two things: speed and a low mortality rate. And this public forum was where that reputation was forged or shattered. They watch with keen, critical eyes. Was the first incision clean? Did he hesitate? How quickly can he sever the limb? They are a jury of his peers, and their silent verdict will be whispered through the halls of the hospital by nightfall. And then there are the others, scattered throughout the crowd, the curious laymen, gentlemen of means with a taste for the macabre, who paid a fee for the privilege of watching. For them, this is entertainment, a thrill, a chilling diversion from the polite boredom of their daily lives. They are no different from the crowds that gathered for a public hanging. They are here for the blood, for the scream, for the raw, unfiltered drama of life and death. You catch the eye of one of them. He is well dressed, a silk cravat at his neck. He is not looking at you with pity or with scientific interest. He is looking at you with a kind of hungry fascination, and in that moment you understand. You are not a patient. You are the show. The air in the theater is thick, heavy. It smells of unwashed bodies, of damp wool, of sawdust, and of fear. Your fear. It's a metallic, coppery scent that seems to cling to the back of your throat. They might burn herbs or incense in a corner, a futile attempt to mask the stench of sickness and impending bloodshed, but it does nothing. The smell of the place is the smell of what it is, a human slaughterhouse sanctified by the name of medicine. The sound, too, is a character in this drama. The constant, low murmur of the crowd is the bass line, but listen closer. You can hear the squeak of the leather straps as you test their strength. A futile gesture. They are thick, old, and buckled tight around your wrists and ankles. They hold you to this table like a specimen pinned to a board. You can hear the clink of metal on a tray nearby. The sound is sharp, precise, and it cuts through the dull hum of the room. It is the sound of the instruments being laid out. Scalpels, forceps, saws. Each one makes its own small, terrible music, and beneath it all, the sound of your own heart, a frantic, desperate drumbeat against your ribs. It is the loudest thing in the universe. Can they hear it? Can this vast, silent crowd hear the terror that is about to tear you apart from the inside, long before the surgeon even makes his first cut? The table itself is a brutal piece of furniture. It is not designed for comfort. It is a solid plank of wood, sometimes with a slight curve to it, sometimes with a gutter to channel the blood. It is hard, unforgiving, and cold against your back. You can feel every knot, every splinter through your thin hospital gown. It is often stained, dark patches where the blood of countless others has soaked into the grain, impossible to ever truly wash away. You are lying in the shadow of their pain. You are joining a long, silent fraternity of suffering. At the foot of the table, there is a bucket, a simple wooden or metal pail. It sits there waiting. If you are here for an amputation, that is its purpose, to catch the limb when it is thrown aside. A casual, final act of disposal. Another piece for the collection. Nearby, a box of sawdust, or sometimes just a thick layer of it spread on the floor around the table. It is there to soak up the blood, to keep the surgeon from slipping as he works. The practicality of it is chilling. They have planned for the mess. They have made preparations for the torrent that is about to be unleashed from your body. Before we witness the surgeon's final preparations, let's take a moment. If these journeys into the darker chapters of our past help you find a sense of quiet, a way to let the modern world fade away, consider subscribing to the Dark Historian. Your support allows these stories to be told. It helps keep the lights on in this museum of forgotten moments. Now, let us return to the theatre. The air is growing colder. The surgeon has been, until now, a presence at the edge of your vision, a tall, dark figure, but now he moves to the center. He steps into the light, and the room falls silent. This is his moment. He is not dressed in the sterile scrubs you would imagine today. He wears his street clothes. A fine woolen coat, perhaps, with the sleeves rolled up. Or maybe he dons a special apron, an apron made of canvas or leather, stiff and dark with the dried blood of previous operations. It is a badge of honor, a testament to his experience. He does not wash his hands. The concept of germs is a fantasy, a madman's dream. Instead, he might wipe them on a nearby rag, or even on his apron. He might even have a favorite knife, one he keeps tucked in a velvet-lined case, its handle worn smooth by his grip. Some surgeons were known to hold the blade between their teeth for a moment before the first cut for dramatic flair, a signal to the breathless audience that the performance was about to begin. He moves with a practiced, deliberate calm. He is the eye of the storm. Around him is a whirlwind of your fear, the crowd's anticipation, the student's anxiety. But he is still. He is the master of this domain. He might address the audience, his voice calm and authoritative. He will explain the malady, the tumor, the gangrene, the shattered bone. He will describe what he is about to do in precise, academic terms. He might point to you with a scalpel, tracing the line of the incision he is about to make in the air above your body. You are a prop in his lecture. He is not a monster. It is important to remember that. In his own mind, and in the minds of most people here, he is a hero. He is the one willing to step into the realm of blood and pain to pull someone back from the brink of death. His arrogance, his showmanship, it is a shield, a necessary armor against the horror of his work. He has to see you as a machine to be fixed, or he would be unable to function. He has to deafen himself to your pleas, or his hand would tremble. So he becomes a performer. He plays the part of the unflappable, all-knowing man of science, and the crowd, in turn, needs him to be that. They need to believe in his godlike power, because the alternative, the truth of this brutal, fumbling, and often fatal art, is too terrifying to contemplate. He turns to the instrument tray. The selection is simple and brutal. There is the knife, the scalpel, for the initial incision. Its steel is polished, its edge honed to a razor's sharpness. There are the forceps and clamps to hold arteries and move tissue. There is the needle and the suture, often just common silk or linen thread, for closing the wound. And then there is the saw, the amputation saw. It is, in many ways, the symbol of this entire era of surgery. Small, with a fine-toothed blade and a handle of carved wood or ivory. It looks almost delicate, but it is designed for one purpose: to cut through human bone as quickly as possible. The surgeon will select it, test its weight in his hand. He knows its balance intimately. Around him, his assistants move into place. These are not trained nurses. They are often junior students, or simply strong men hired for the task. Their job is not to comfort you. Their job is to hold you down. Even with the leather straps, a person in the throes of unimaginable agony can thrash with superhuman strength. These men are the final layer of restraint. They will put their hands on your shoulders, on your legs. Their weight will press you into the hard wood of the table. Their faces will be inches from yours, grim, determined, and deaf to your cries. They are the living clamps of this terrible machine. The surgeon takes a final look around the theatre. He makes eye contact with a colleague in the front row, a slight nod of acknowledgement. He is ready. The students lean forward, their notebooks open. The spectators hold their breath. The silence in the room is now absolute. It is a heavy, suffocating blanket. The only sound is the frantic pounding of your own heart and the ragged gasp of your own breath. You look up past the surgeon, past the tears of watching faces, to the skylight high above. It is just a patch of grey, indifferent sky. There is no salvation there. There is no escape. The world has been reduced to this single, terrible room, to this table, to this moment. The surgeon raises the knife. The light from the window catches the steel blade, and for a blinding second, it shines like a sliver of a star. A cold, distant, and merciless star. He looks down at you. His eyes are not cruel. They are simply focused. He is no longer seeing a person. He is seeing a task, a line to be cut, a job to be done. And then he begins. The performance is over. The real work, the work of pain, is about to start. The silence is about to be broken, and the theatre will get what it paid for. The air in the room is thick, so thick you can almost taste it. It's a cocktail of carbolic acid, unwashed bodies, and something else, something metallic and electric. The scent of fear. The audience, a gallery of dark suits and pale faces, leans forward over the iron railing. They are a sea of shadows, their individual features lost in the gloom of the gaslights. All you can see are their eyes, wide and fixed, fixed on the center of the room, fixed on the table, fixed on the person lying there. The surgeon stands over the table, a stark figure in a blood-stiffened apron. He doesn't look at the gallery. He doesn't look at his assistants, who are moving with a quiet, grim efficiency. He looks only at the leg, the shattered, mangled leg, a monument to a factory accident or a fall from a horse, or perhaps the simple, creeping rot of gangrene. The reason no longer matters. The verdict has been passed. It must come off. This is the moment before the storm, the final intake of breath before the plunge. For the men in the gallery, it is a spectacle, a lesson in anatomy and human endurance. For the surgeon, it is a race against time, a battle against shock and blood loss, measured in seconds. But for the person on the table, wide-eyed and sweating, this silence is the most terrifying sound in the world. It is the sound of their own life, their own body, balanced on the edge of a knife. The first step is not the cut, it is the squeeze. An assistant takes a thick leather strap, a tourniquet, and wraps it high up on the thigh, far above the diseased flesh. There is a wooden handle attached, a toggle, and he begins to twist it. You feel the pressure immediately, a dull, spreading ache. He twists again. The ache sharpens. The muscle beneath the leather begins to scream in protest. You can feel your own pulse hammering against the strap, a frantic, trapped bird. Another twist. The pressure is immense now, a crushing geological force. It feels as if the bone itself might splinter. The blood flow slows, then stops. The vibrant, living warmth of your limb begins to fade, replaced by a strange, cold numbness, a dead weight. It is a deeply unsettling sensation, the feeling of a part of you dying before it has even been taken. The assistant secures the handle, the tourniquet biting deep into your flesh. The leg is now a pale, mottled color, isolated, prepared. This preliminary pain is a promise, a grim overture for the symphony of agony to come. The surgeon nods. He doesn't speak. There is no need for words. Everyone in this room knows their part in this brutal play. An assistant steps forward, holding not a scalpel, but something that looks more like a tool from a butcher's shop. It is an amputation knife, a long single-edged blade, slightly curved, gleaming under the gaslight. It is designed for one purpose: to get through skin, fat, and muscle in a single, fluid motion. Speed is mercy. That is the surgeon's creed. A fast surgeon is a good surgeon. Robert Liston, a famous surgeon of this era, was said to be able to take a leg off in under 3 minutes. Sometimes in his haste, he might accidentally take a patient's testicles as well, or even the fingers of his assistant, holding the leg down. But he was fast. And in a world without anesthesia, speed was the only kindness a surgeon could offer. You watch the surgeon take the knife. His grip is firm, practiced. For a heartbeat, his eyes meet yours. There is no pity in them. There can't be. There is only a focused, chilling professionalism. He is about to inflict an almost unimaginable amount of pain, and to do so, he must become a machine of flesh and steel. He mouths a single word: courage. Then he turns his attention back to the leg. He places the heel of the blade against the skin. It is cold. A shocking, sharp cold that makes you gasp, and then he cuts. There is no time to process it. It is a blur of motion and a white-hot explosion of pain. A line of fire drawn around your thigh. The blade is impossibly sharp, and it moves with incredible speed, circling the limb. It's not a clean slice like a paper cut. It's a deep, violent severing. You feel the tearing of tissue, the parting of muscle fibers that have held you up your entire life. Your back arches off the table, a purely involuntary reaction. Your body trying to escape the inescapable. The scream that you've been holding back erupts from your lungs. It is not a human sound. It is a raw, primal shriek of pure agony that fills the theatre, bouncing off the stone walls. It is the sound the gallery came to hear. Some flinch. A few of the younger students look pale, their bravado gone. But most just lean in closer, their morbid curiosity overriding their empathy. They need to see. The surgeon is already making the second cut, angled upwards, shaping the flesh into a flap that will, hopefully, be used to cover the stump later. More pain, blinding, searing pain. Your world shrinks to this single, overwhelming sensation. There is nothing else. No past, no future. Only the blade and the fire it leaves in its wake. The assistants, large, strong men, are holding you down now. Their weight is a crushing burden on your chest, your shoulders, your good leg. You struggle, but it is useless. You are pinned, a specimen on a board. The surgeon drops the bloody knife with a clatter into a metal tray. The first act is over. The flesh has been parted. The glistening, white bone is now exposed to the air. You can see it. Your own femur, the core of you, laid bare. For a moment, there is a pause, a breath. The surgeon reaches for the next instrument, and you know with a fresh wave of dread that the worst is yet to come. He picks up the saw. It is a simple frame saw, not unlike one a carpenter would use, but its purpose is infinitely more gruesome. The teeth are sharp and hungry. The sound it makes as he places it against your bone is a dry, rasping scrape. It is a sound that you feel more than you hear. It travels up the bone, through your hip, into your spine. It vibrates in your skull, in your teeth, and then he begins to move it. Back and forth, the sound. That is what you will remember for the rest of your life, however long that may be. A grating, grinding, screeching noise. The sound of a living thing being unmade. It is a slow, rhythmic agony. With each pull, The teeth bite deeper with each push. A fine powder of bone dust sprays into the air, mingling with the blood. You can smell it. A hot, chalky smell. The smell of your own skeleton being destroyed. Time ceases to exist in any meaningful way. Each second is an eternity of noise and vibration. The surgeon puts his weight into it, his knuckles white. Cutting through the femur, the largest bone in the human body, requires immense physical effort. You can see the strain on his face, the sweat beading on his forehead. He is focused, his movements economical, but the bone is strong. It resists. You are screaming again, but you can barely hear it over the sound of the saw in your own head. Your vision whites out at the edges. The faces of the assistants holding you down are a blur. The gallery above is just a smear of darkness. The entire universe has been reduced to this single point of contact. Saw tooth on living bone. Back and forth. Back and forth. The rhythm is hypnotic in its horror. It is the heartbeat of your own destruction. You pray for unconsciousness. You pray for the black curtain of oblivion to fall and give you peace. But it does not come. Your body is too flooded with adrenaline, too wired with pain. You are forced to be present for every single, agonizing moment. You feel the saw snag, then break free. You feel a subtle shift in the vibration as it nears the final edge of the bone. The surgeon gives one last, powerful push. There is a final, sickening crack, a sound of finality. The resistance is gone, the sawing stops, and the silence that rushes back in is somehow just as loud, just as shocking. The lower part of your leg, from the thigh down, is no longer attached to you. One of the assistants, who was holding it steady, now holds it free. It is a dead thing, a piece of meat. He carries it without ceremony and drops it into a wooden box filled with sawdust on the floor. It lands with a soft, wet thud. You stare at the empty space where your leg used to be. Your brain cannot comprehend the absence. The pain is still there, a phantom ache where your foot should be, but the weight is gone. There is a profound sense of violation, of being incomplete. A part of you, a part that carried you through your life, that learned to walk, to run, to stand, is now in a box on the floor. But the ordeal is not over, not even close. The open stump is a fountain of blood. The tourniquet has held back the tide. But now the surgeon must work quickly to prevent you from bleeding to death on the table. He drops the saw and picks up a tenaculum. It is a small, sharp hook. He uses it to probe the bloody mess of the stump, searching for the severed arteries. When he finds one, he snags it with the hook and pulls. Another jolt of sharp, specific pain, as if a nerve has been plucked like a guitar string. He pulls the artery out from the receding muscle tissue so his assistant can tie it off with a ligature, a piece of silk, or linen thread. They have to do this for every major vessel. The femoral artery, the smaller ones, each pull of the hook, each tightening of the thread, is another small, deliberate act of torture. If you are finding this journey into the past helps you to quiet your mind, to find rest in the deep shadows of history, consider taking a moment to subscribe to The Dark Historian. It allows these stories to continue, and it ensures you will not miss our future explorations of history's darkest corners. Now, let us return to the theatre, where the surgeon's work is not yet finished. He has tied off the major bleeders. The gushing has slowed to a steady, dark ooze. Now, he must close the wound. He takes the flap of skin and muscle he so carefully carved at the beginning and pulls it down over the raw, sawn end of the bone. He begins to stitch it shut with a thick needle and thread. Each pierce of the needle through your already traumatized skin is another spark in the raging inferno of pain. He works quickly, his stitches large and crude. This is not about aesthetics. It is about survival. In some cases, the surgeon might choose a different method. Cauterization, if the bleeding cannot be stopped, or if infection is a deep concern. An assistant would fetch the cauterizing irons from the brazier in the corner of the room. They glow a cherry red. The smell of hot metal fills the air, and then the surgeon presses the iron against the stump. There is a loud hiss, a plume of steam and smoke that smells of cooking meat. Your meat. The pain is absolute. It is a final, overwhelming wave of agony that finally, mercifully, pushes your consciousness over the edge. The world dissolves into blackness. Fainting was often the only respite a patient could hope for. But let us imagine you do not faint. You remain awake as he finishes the last stitch. He packs the wound with lint, a material called charpai, to absorb the blood and pus that will inevitably come. He wraps the stump in linen bandages, layer after layer, until it is a thick, white bundle. It is over. The entire procedure, from the first twist of the tourniquet to the final bandage, may have taken less than 10 minutes. But for you, it has been a lifetime, an eternity spent in hell. The assistants lift you from the table. You are weak, shaking, and covered in a cold sweat. The blood loss has made you lightheaded. The shock is setting in. They carry you from the operating theater, past the silent, watching gallery, and place you in a bed in a crowded, noisy ward. There is no recovery room. There are no painkillers. You are given a sip of brandy or laudanum if you are lucky, a small, inadequate gesture against the tidal wave of throbbing, burning pain that is just beginning to build in what remains of your leg. The danger has not passed. In fact, the surgeon's work was the easy part. Now begins the real battle, the fight against infection. In this era, before germ theory, surgeons operated in their street clothes. They used unsterilized instruments, wiping them on their aprons between procedures. The operating theater was a temple of bacteria. Hospital gangrene, sepsis, tetanus. These were the ghosts that haunted every surgical ward. Your chances of survival after a major amputation were, at best, 50-50. In some hospitals, it was far lower. You would lie in that bed for days, for weeks, your body racked with fever, the stump swelling and turning black, the smell of rot filling the air around you. You would listen to the men in the beds next to you groaning, screaming, and then, one by one, falling silent. And all you can do is lie there and wait, and remember the sound of the saw. That terrible, grating rhythm that has now become the soundtrack to your nightmares. You feel for your leg, a ghost limb that itches and aches and cramps, a constant, cruel reminder of what you have lost. This was not an exception. This was the rule. This was the price of surgery. A price paid in full, with every scream, every tear, every conscious moment of indescribable agony. It was a brutal transaction, trading a limb for a chance at life. And as you lie in the dark, listening to the sounds of the ward, you are left to wonder if it was a price worth paying. The silence of the night is no longer a comfort. It is just an empty space, waiting to be filled by the memory of the noise, the grinding and the grating and the final terrible snap. But the noise, even in memory, is not the only horror. There is a different kind of violation, A different kind of fear. It is one thing to see the saw approach the limb you are about to lose. You can watch it happen. You can comprehend the geography of the violence. It is an attack on the borders of yourself. But what happens when the attack is not on the border, but on the interior? When the journey is not one of separation, but of invasion? The pain of a shattered leg is one thing. The pain of something growing inside of you, a jagged crystal of your own body's making, is another. A torment from within. They called them bladder stones, a simple name for a complex misery. Imagine a constant, grinding pressure in your lower abdomen, a fire that never goes out. Every step sends a jolt of agony through you. Sitting is torture. Lying down offers no relief. The simple, natural act of passing water becomes a moment of searing, white-hot dread, a pain so intense it can make a grown man black out, and it never, ever stops. It is a life sentence of escalating torment, one that slowly poisons your entire system until you succumb to infection or kidney failure. This was a common affliction. From kings to commoners, no one was safe from this internal crystallization of pain. And for this, there was a special kind of surgeon. They were not the same as the battlefield butcher who specialized in the quick work of the amputation. No, this required a different skill set, a terrible intimacy. They were known as lithotomists, the stone cutters. Many were itinerant, traveling from town to town with their distinctive roll of tools. When the lithotomist arrived, it was an event, a grim spectacle. The desperate would line up, men and women who had exhausted every prayer, every herbal poultice. They were ready to trade a few minutes of unimaginable agony for the possibility of a life without it. What choice did they have? Live with the stone and you face a slow, certain, agonizing death. Go under the cutter's knife and you face a quick, uncertain, agonizing procedure. The odds were not good, but they were better than zero, so you make the choice. The cutter unrolls his tools on a piece of leather. They don't look like a healer's instruments. They look like a stonemason's or a torturer's. There is the staff, a long, curved metal rod designed to be inserted into the urethra and pushed down until it makes contact with the stone. This is the guide. It allows the surgeon to feel for his target from the outside. The sound of it, a dull clink of metal on stone, heard from within your own body, is the signal that the real work is about to begin. You are forced into a position of ultimate vulnerability. On your back, legs pulled up and spread wide, tied to your own shoulders or held fast by strong assistance. The lithotomy position, a name that has survived into modern medicine, a ghostly echo of this ordeal. You are exposed, helpless, staring at a ceiling you pray you will see again. The surgeon doesn't use the front of the body. The risk of damaging vital organs is too high. Instead, the incision is made in the perineum, that small, sensitive space between the genitals and the anus. There is no slow, careful cut. Speed is everything. The knife is a specialized one, a bistoury. It is sharp, it is quick. One deep, decisive slash. Pain, blinding, searing pain that eclipses everything you have ever known. The stone inside you is forgotten. The world collapses into this one, singular, fiery wound. But it's not over. That was just the entrance. Now the surgeon inserts another tool, the gorget, a wide, grooved instrument that follows the path of the staff, tearing the wound open wider, creating a channel. Then come the forceps or a scoop, metal probes, scraping and searching inside the most delicate part of you. You feel the cold, hard steel moving within your body, a feeling so unnatural, so profoundly wrong, it borders on madness. The surgeon is hunting, he is feeling for the stone, trying to grasp it. You can hear the scrape, metal on stone. The sound vibrates through your bones. He grasps it, but it's slippery, it's jagged, it slips from the forceps. He tries again, more scraping, more pain. The bleeding is torrential. The assistants work to hold you down as your body convulses, trying to escape an inescapable agony. Finally, he gets a grip, and he pulls. The stone is not small. It is not smooth. It has sharp, crystalline edges. As it is dragged out through the wound, it tears everything in its path, muscle, tissue, nerves. The pain is a crescendo. It is impossible, but it is happening. And then, a sudden release. A wet, tearing sound. The surgeon holds up the prize, a bloody, irregular rock, your stone, the cause of all your misery, now held in the light for all to see. For a moment you feel nothing, just a hollow, ringing silence, but the ordeal is far from done. There are no stitches. The wound is often packed with linen or just left open to drain. Infection is almost a certainty. Sepsis, gangrene, fistulas that never heal. Many who survived the table died in the weeks that followed in a feverish, delirious haze. Yet, some survived. The famous diarist Samuel Pepys was one. He was so grateful to have survived the procedure in 1658 that he had his stone mounted in a special case and held a feast every year to celebrate the anniversary of his cutting. It was a testament to the sheer desperation of the patient, a willingness to gamble with death to be free of a pain that was worse than death. This was the journey inward, into the core of the body. A brutal excavation, but there was another journey, one that went even deeper, one that went up. To the head, the skull is our fortress. It is the bone box that protects the most mysterious and essential part of us, the seat of thought, of memory, of self. To breach that wall, to intentionally open it while the person was still alive, it seems like an act of pure insanity. And yet, it is one of the oldest surgical procedures known to humanity. It is called trepanation. Archaeologists have found skulls in Neolithic burial sites, thousands and thousands of years old, with perfectly round, beveled holes cut into them. And the most astonishing part, the bone around the edges of the hole shows signs of healing. Clear, undeniable evidence that the person did not die on the table. They lived for weeks, months, even years, with a hole in their head. Why would they do this? For some, it was likely practical. A warrior takes a blow to the head. The skull isn't broken through, but it's fractured, dented. Blood builds up underneath, creating immense pressure on the brain. The person suffers from headaches, seizures, paralysis. The logic is brutal, but clear: relieve the pressure. Make a hole to let the badness out. But the reasons went far beyond simple trauma. In a world without knowledge of neurology, where the workings of the brain were pure mystery, the skull was seen as a container for the spirit. And sometimes spirits could be malevolent. Epileptic seizures, a demon thrashing inside the skull. Crippling migraines, a noxious vapor trapped within, seeking escape. Melancholy madness, what we would now call severe mental illness. An evil presence that had taken up residence. The cure was obvious. You had to give the spirit a doorway, an exit. You had to open the skull. The tools were simpler, and perhaps even more terrifying than the lithotomists. In ancient times, it might have been a sharpened piece of flint, scraped and scraped against the bone for hours, or even days, slowly wearing a hole through the skull. Later, the technology evolved. The trepan was a cylindrical saw, a crown of sharp teeth that could be turned by hand or with a bow drill like one used to start a fire. Imagine that. The rhythmic whirring of the bow, the slow, grinding screech of metal teeth on your own bone. And then there was the brace and bit, essentially a carpenter's drill. The surgeon would place the sharp point against your skull and begin to turn. You are awake for this. You have to be. There is no way to render you unconscious. Perhaps you've been given a strong dose of wine or a draught of opium, but it does little more than dull the edges of your terror. You are held down, your head clamped in place. The surgeon shaves a patch of your hair. The scalp is sliced open and pulled back, exposing the pale, white bone beneath. You feel the cold air on your own skull. Then the drilling begins. The pressure is immense. The sound is inside your head, a low, grating vibration that resonates through every part of you. You can smell it, the smell of burning bone, a uniquely acrid and unpleasant scent. The surgeon works slowly, carefully. He has to. The skull is not uniformly thick. Go too far, too fast, and the drill will plunge directly into the soft, delicate tissue of the brain, an instant and almost certain death. He stops frequently, checking the depth of the groove, blowing away the bone dust. You lie there, listening to the sound of your own fortress being breached. You can feel the heat from the friction. You can feel the vibration in your teeth, in your jaw, and then a change, a slight give, a different sound. The surgeon has broken through. He can now use an elevator to pry the small, circular piece of bone, the roundel, free. It is lifted away, and there it is, the dura mater, the tough outer membrane that encases the brain. The assistants, the surgeon, they can all see it, pulsing, glistening, moving with the rhythm of your own heartbeat. They have opened the door. What happens next depends on the purpose. If it was for pressure, a dark trickle of trapped blood might escape, a momentary relief. If it was for a demon, the opening was now there. The spirit was, theoretically, free to leave. An exorcism by surgery. The piece of bone was often kept by the patient, a talisman, an amulet to ward off the evil that had once possessed them, proof of their survival. The wound in the scalp would be closed, or a metal plate might be placed over the hole for protection. But the real danger, as always, was what came next. The brain is the most protected organ in the body for a reason. With the skull breached, the path for infection was wide open. Meningitis, an inflammation of the very membranes they had just exposed, was a common and agonizing way to die. A fever, a stiff neck, delirium, and then darkness. Yet again, we know people survived. They walked the earth with these windows in their skulls, a permanent opening to the world, a constant, terrifying reminder of the day the surgeon came, not to remove a limb, but to open a door into their very soul, from the bladder to the brain, from the seat of our most basic functions to the seat of our consciousness. These procedures represent a profound leap of faith and a profound act of violence. It was a medicine of last resort, a brutal calculus of pain. The surgeon's knife, the lithotomist's scoop, the trepan's grinding teeth, these were not instruments of gentle healing. They were weapons in a desperate war against an internal enemy. They were fighting the stone. They were fighting the demon. They were fighting the pressure in the skull. But mostly, they were fighting the pain. A pain so absolute that it made even these horrors seem like a reasonable choice. The line between healer and attacker, between salvation and butchery, was never so thin. It was a line drawn with a bloody knife on a conscious, screaming body, in the faint hope that on the other side of the agony lay not death, but relief. A quiet, peaceful moment where, for the first time in years, nothing hurt. That was the prize. And it was a prize for which people were willing to risk everything. And so the hunt began. Not a hunt for treasure or territory, but for something far more elemental. A hunt for a moment of quiet. A search for a key that could turn the lock on pain, even for just a few minutes, and grant a surgeon the stillness they so desperately needed. It was a search that would lead down dark, strange, and often deadly paths. For generations, the brightest minds in medicine threw everything they had at the problem. They used chemistry, they used psychology, they used brute force, and for generations they failed. The most common weapon in this fight was, perhaps unsurprisingly, the one most readily available: alcohol. You can picture it, can't you? The surgical theatre, already smelling of blood and fear, is now thick with the fumes of cheap whiskey or raw brandy. The patient, pale and trembling on the table, is handed a bottle, not a glass, a bottle. And the instruction is simple: drink. Drink until you can't feel the fear anymore. Drink until the faces of the men holding you down begin to blur. Drink until the world softens at the edges. It made a grim kind of sense. Anyone who had ever had too much to drink knew its power to numb, to make you clumsy, to make you brave, to make you forget. Surgeons hoped to push that numbness to its absolute limit, to find that razor-thin line between a drunken stupor and true oblivion. The patient would be forced to drink, and drink quickly, a large volume of potent spirits, hoping to overwhelm the senses before the first cut was ever made. The idea was to bring the patient to the very edge of consciousness, to a place where the body might still react, but the mind would, hopefully, remember nothing. But here's the problem, and it was a fatal one. Alcohol is a terrible anesthetic. It is unpredictable. The amount needed to render one person unconscious might kill another. It's a poison, after all, and the line between surgical numbness and lethal alcohol poisoning is not a line at all. It's a smudge, a grey, treacherous zone where the patient's breathing could slow and then simply stop. And even when it didn't kill, it rarely worked as intended. Instead of a quiet, placid patient, surgeons often found themselves dealing with someone who was violently, belligerently drunk. Imagine trying to perform a delicate procedure on a person who is thrashing, shouting, or trying to fight back. The alcohol didn't erase the pain, it just stripped away the person's control, their inhibition, their reason. They would still feel the bite of the steel, but now they would react with a wild, unpredictable fury. Then there was the blood. Alcohol is a vasodilator. It opens up the blood vessels. For a surgeon whose greatest enemy is blood loss, this was a catastrophe. A wound that might have been manageable now bled with a terrifying ferocity. The very substance meant to help the patient was actively making the surgery more dangerous, turning the operation into a frantic race against hemorrhage. The surgeon, hands slick with blood that wouldn't stop flowing, would have to work even faster, which only meant more mistakes, more trauma, more pain for the drunken, struggling person on the table. It was a fool's bargain. You traded a screaming, conscious patient for a screaming, drunk, and profusely bleeding patient. It was a tool, yes, but a crude and clumsy one. A sledgehammer used to fix a watch, and for every story of a stoic sailor who supposedly got through an amputation with nothing but a bottle of rum and a leather strap between his teeth, there were 1,000 other unwritten stories. Stories of men who died not from the knife, but from the cure. Stories of operations that failed because the patient was too violent to control. It was a desperate measure for desperate times. And it was not enough. When the raw power of spirits failed, they turned to something more subtle, something ancient and mysterious, with a history wrapped in dreams and shadows. Opium. And its potent derivative, laudanum, a tincture of opium dissolved in alcohol. Unlike the violent chaos of whiskey, opium offered a different promise, the promise of a gentle drift, a release. In the homes of the wealthy, where laudanum was a common fixture in the medicine cabinet, a patient might be given dose after dose in the hours leading up to a surgery. The goal wasn't necessarily to achieve unconsciousness, but something else, a state of detached bliss, a waking dream. The air in the room would grow heavy with its sweet, cloying scent. The patient's eyes would glaze over. The world, with its sharp edges and its looming horrors, would melt into a soft, hazy watercolor. The theory was that if the patient could be made to not care about the pain, then perhaps the pain itself would cease to matter. They would float above their own body, an indifferent spectator to the grim work being done below. And sometimes, for some people, it offered a sliver of that. They would remember the surgery not as a clear, sharp memory of agony, but as a confusing, terrifying nightmare, flashes of light, the pressure of a blade, muffled voices, but all of it experienced through a thick, syrupy fog. It was better than the alternative, perhaps. A nightmare is better than a waking torture. But opium, like alcohol, was a treacherous ally. It is a painkiller, a magnificent one. But it is not an anesthetic. It doesn't block the signals of pain from reaching the brain. It just changes how the brain responds to them. The body still feels everything. The nerves still scream their silent warnings. The heart still pounds in terror. The patient might be too sedated to thrash or scream, giving the surgeon the stillness they craved. But the trauma was still being inflicted, still being recorded by the body, if not the conscious mind. And the dosage was a terrifying gamble. Opium is a powerful respiratory depressant. Too small a dose, and the patient remains lucid, their pain merely wrapped in a confusing, drug-addled haze. A fraction too much, and their breathing becomes shallow, slower, and slower still, until it just fades away. The surgeon, focused on his bloody work, might not notice until it was too late. The patient wouldn't cry out. They wouldn't struggle. They would simply slip away, dying silently on the table from the very medicine meant to save them. Even for those who survived both the surgery and the sedation, the ordeal wasn't over. The after effects of such massive doses of opiates were severe. Days of nausea, vomiting, and debilitating constipation would follow, complicating the healing process and making the patient even weaker. They had traded a few hours of sharp agony for days of dull, lingering misery. So the search continued. These chemical paths, the bottle and the poppy, were proving to be little more than dead ends. They offered a sliver of hope, just enough to keep people trying, but they were unreliable, dangerous, and ultimately a failure. The prize, that true moment of oblivion, remained as distant as ever. This search, this desperate grasping for any tool to silence the screams, it tells us so much about the human spirit, the sheer refusal to accept suffering as inevitable. Before we explore the other, stranger paths they took down this dark road, I want to take a moment to thank you for being here with me tonight. If these journeys into the past help you find a bit of quiet in your present, consider subscribing to The Dark Historian. It's a simple, silent way to support the channel, and it allows these stories to continue. Now, let us return to that operating theatre. The surgeons, frustrated with the failures of chemistry, were about to turn their attention from the body to the mind. And this is where the story gets truly strange, because in the late 18th and early 19th centuries, a new and controversial idea was sweeping across Europe. It was called mesmerism. We know it today as hypnotism. Its founder, a German doctor named Franz Mesmer, believed in a force he called animal magnetism. He claimed that all living things were filled with an invisible magnetic fluid, and that sickness was caused by blockages in the flow of this fluid. A trained mesmerist, he argued, could manipulate this fluid, unblocking it with a series of slow, deliberate hand gestures or passes, and restore a patient to health. To the established medical community, it sounded like pure fantasy, charlatanism, a parlor trick for the gullible. But some surgeons, desperate for any advantage, were willing to listen. What if, they wondered, this mental influence could be used not just to cure disease, but to command the senses themselves? What if you could simply tell the brain not to feel pain? The practice was bizarre to watch. A surgeon, or a dedicated mesmerist, would stand over the patient. No drugs were administered. No restraints were used. The room would be kept quiet, the lights low. The mesmerist would begin, making slow, sweeping passes with his hands over the patient's body, never touching them, his eyes locked on theirs. He would speak in a low, soothing monotone, telling them to relax, to let go, to feel a heaviness in their limbs, to feel their eyelids grow heavy. For many patients, nothing happened. They would lie there, feeling foolish, fully awake and acutely aware of the absurdity of the situation. The surgeon would sigh, pick up his saw, and the assistants would grab the patient's limbs. The old, brutal way would have to do, but sometimes something happened. Something inexplicable. The patient's breathing would deepen. Their body would go limp. They would enter a deep trance, seemingly asleep, yet still able to hear and respond to the mesmerist's voice. The surgeon, skeptical but hopeful, would take a small pin and prick the patient's skin. No reaction. He would make a small test incision. The patient would not flinch. It was in these moments that medical history held its breath. In British-controlled India, a surgeon named James Esdale became the most famous proponent of mesmeric surgery. Working in horrific conditions, he claimed to have performed over 300 major operations, including amputations of legs, arms, and the removal of massive tumors, all on patients who were under a hypnotic trance. His reports described patients who lay perfectly still, their pulse steady as he worked. They would awaken afterwards with no memory of the procedure, asking when the surgery was going to begin. To Esdale and his followers, it was a miracle, a revolution, the final conquest of pain, achieved without a single drop of a dangerous drug. But the medical establishment in Europe remained deeply skeptical. They accused him of exaggerating his results, of coaching his patients, or of using patients who were simply in a state of shock or catatonia. The process was too unreliable. It didn't work on everyone. It depended entirely on the patient's suggestibility and the practitioner's mysterious skill. How could you build the future of surgery on something so flimsy, so theatrical? And what happened when it failed mid-procedure? Imagine the horror. A patient, seemingly lost in a peaceful trance, suddenly awakens. Not slowly, not groggily, but instantly. They awaken to the sight of their own body laid open, to the sound of a saw grating against their bone, to a sudden, overwhelming explosion of agony. The shock alone could be fatal. It was a risk few were willing to take. Mesmerism remained on the fringes, a fascinating but ultimately impractical curiosity. The mind was a lock, but no one had found a reliable key. So the search was forced back to the physical. If you couldn't trick the mind, and you couldn't safely poison the body into submission, what was left? Only the most brutal, the most primal, the most desperate method of all. A direct assault on consciousness itself, blunt force trauma. It is the crudest form of anesthesia imaginable. The logic is as simple as it is horrifying. A conscious brain feels pain. Therefore, render the brain unconscious. The method was stark. A wooden mallet, a lead pipe wrapped in leather, a sandbag. The target was the patient's head. The goal was to strike the patient with just enough force to induce a concussion, knocking them out cold for the few minutes the surgeon needed to do their work. This wasn't medicine. This was a calculated act of violence in the service of healing. An assistant, often the strongest and most stoic person in the room, would be tasked with delivering the blow. You have to try and imagine that moment. The patient on the table, eyes wide with a terror that is beyond comprehension. They know what's coming. They know that before the surgeon's knife cuts them, the assistant's mallet will fall. The surgeon gives a grim nod. The assistant raises the weapon, and in one sickening thud, the patient's world goes black. For a few precious moments, the surgeon has what he needs. Silence, stillness. But it was a stillness bought at a terrible price. The margin for error was non-existent. A blow that was too soft would fail to knock the patient out, resulting in nothing but a fractured skull and a patient who was now in even more agony. A blow that was too hard, even by a fraction, could cause a cerebral hemorrhage, irreversible brain damage, or instant death. Every single time it was used, it was a roll of the dice with a human life. The surgeon was trading the certainty of surgical pain for the high probability of a catastrophic head injury. Patients who survived the surgery and the blow would often wake up changed. They would suffer from headaches, from memory loss, from seizures for the rest of their lives. They were saved from the gangrenous leg, but a part of their mind, their personality, their very self, was shattered in the process. This was the absolute end of the road, the final admission of defeat. This was the point where medicine stopped and barbarism began. It showed just how hopeless the situation had become. They had tried everything. They had filled patients with liquor and with opiates. They had tried to whisper the pain away with the power of the mind, and they had resorted to beating them into unconsciousness. Each path had led to the same place, a place of failure, of danger, and of profound suffering. The operating theatre at the dawn of the 19th century was a place of despair. It seemed that pain was an unconquerable mountain, an essential, unavoidable part of the human condition and an absolute barrier to the progress of medicine. The screams still echoed in the halls. The prize remained unclaimed. The search, it seemed, was over, and it had failed, but history is full of quiet moments that change everything, and in dentists' offices and university laboratories, a few curious individuals were experimenting with strange, sweet-smelling gases. They were using them at parties, for entertainment, to make people laugh and feel giddy. They had no idea that the answer to the surgeon's prayer was hidden in the very air they were breathing. The futile search was about to end, and a new age was about to begin, but conquering the scream was not the same as conquering death. The new age that was dawning had a shadow, a long and silent one, that fell over every patient who survived the knife. You see, the ordeal on the operating table was only the first battle. The war for your life had just begun. Imagine it. You've made it through. The blinding agony is gone, replaced by a deep, throbbing ache that is almost a relief in comparison. You are weak, exhausted, but you are alive. The surgeon, perhaps with a rare, tired smile, tells you the tumor is gone, the leg is set, the stone is removed. You are laid in a long ward, on a cot beside dozens of others, each nursing their own fresh wounds. The air is thick with the smell of unwashed bodies, stale blood, and something acrid you can't quite place. But for a day, maybe two, there is hope, a fragile, flickering hope. Then it begins. A warmth spreads from the bandages, a heat that has nothing to do with the thin blanket covering you. It's an angry, insistent heat. The dull ache sharpens, twisting into a vicious, pulsing torment that makes you clench your teeth. A fever begins to creep into your bones. Your skin feels tight, stretched over the swelling flesh beneath. When the surgeon or his apprentice comes to change the dressing, you brace yourself. They peel back the stained linen, and there, welling up from the stitches, is a thick, creamy, yellowish-white substance. Pus. The surgeon leans in close, his face unreadable in the dim light of the ward. He studies the wound, perhaps prods it gently with an unwashed finger. You watch his face, your heart hammering against your ribs, waiting for the verdict. Is this it? Is this the beginning of the end? And then he straightens up, and a look of satisfaction crosses his features. Excellent, he might say, his voice calm and professional. Laudable pus. A very good sign. Laudable. Praiseworthy. He is looking at the corruption seeping from your body, and he is pleased. He sees it not as a sign of decay, but as a sign of healing. To our modern ears, it sounds like madness, like praising a fire that is about to consume your house. But to the mind of a pre-germ theory physician, it made a strange, desperate kind of sense. They were working in the dark, you see. They had no concept of bacteria, no idea that a universe of invisible life teemed on their hands, on their instruments, in the very air of the ward. They operated based on observation and ancient theories of the body's humors, and what they observed was this: when a deep wound began to heal, it often produced this thick, odorless pus. They contrasted this with the alternative: a thin, watery, foul-smelling discharge, often tinged with brown or green. This other fluid, they knew, was a death sentence. It signaled a putrefaction that would inevitably lead to delirium, decay, and death. So, in their world of limited knowledge, they created a system. There was good pus and bad pus. The good, laudable pus was thought to be the body's natural way of expelling the bad humors or damaged tissues from the wound. It was a healthy, necessary part of the process. The surgeon wasn't seeing an infection. He was seeing a victory. He believed your body was successfully fighting off whatever internal imbalance had caused the problem in the first place. He would encourage it, sometimes applying irritating poultices made of bread or dung to try and draw out more of this healthy discharge. The belief in laudable pus was a monument to humanity's ability to find patterns in chaos, to build a framework of reason even when the fundamental premise is wrong. It was a desperate attempt to impose order on a process that was, for them, utterly mysterious and terrifyingly random. But it was a fatal mistake. The surgeon, in his satisfaction, was looking at a raging bacterial infection and calling it a good omen. He was praising the very agent that was, cell by cell, preparing to consume his patient. For the patient on the cot, that pronouncement of laudable pus might offer another day of that fragile hope. But soon the signs would become undeniable. The fever would not break. The chills would set in, rattling your bones so hard the cot itself would shake. The pain would intensify beyond all measure, a constant fiery presence. The red streaks would begin to appear, crawling up your limb from the wound like angry veins on the surface of your skin. This was erysipelas, the St. Anthony's fire, an infection that burned its way through the flesh, leaving blisters and blackened skin in its wake. It felt as though you were being cooked from the inside out. Or perhaps the signs were different. Perhaps the flesh around the wound would begin to feel cold, numb. The color would change, from an angry red to a bruised purple, then a ghastly, mottled grey-green, and finally a dead, leathery black. And the smell, a sweet, sickly, rotten odor that would cling to the blankets, to your clothes, to the very air you breathed, an odor you could taste. This was hospital gangrene. It was the death of the body while the mind was still trapped inside, a spectator to its own decay. The surgeon, seeing this, would lose his look of satisfaction. His face would become a mask of grim necessity. There was only one treatment for gangrene: the knife. Again, he would have to amputate higher up the limb, cutting through healthy tissue in a desperate race against the creeping death. If you survived this second ordeal, you would be back in the same cot, in the same foul air, with a new wound, waiting to see if the blackness would return. And for so many, it did, but the most feared killer in the surgical wards was the most subtle. It had no dramatic rash, no creeping blackness. It was a systemic poison. They called it pyemia or septicemia. Blood poisoning. We just call it sepsis. It began with the fever and chills, but then the mind would begin to cloud. Confusion. Delirium. You might speak to people who weren't there, thrash against imagined restraints. Your breathing would become rapid and shallow, your heart racing to keep up, your body, overwhelmed by the infection coursing through your veins, was beginning to shut down, organ by organ. This was the great terror of the hospital. It was so common they gave it a name: hospitalism. It was a recognized phenomenon that a patient with a simple, clean wound was more likely to die of infection if they were treated in a grand city hospital than if they were treated in a rural cottage or even a dirty barn. The great surgical wards of London, Paris, and Vienna were not sanctuaries of healing. They were chambers of death. They were reservoirs of infection, concentrating all of the invisible pathogens into one place. Let's walk through one of these wards in our minds. The year is 1850. The windows are kept shut for fear that the night air, the miasma, would bring in disease. The floor is bare wood, stained with generations of blood, pus, and vomit. The beds are crammed together, sometimes 2 patients to a bed. The straw mattresses are soiled and rarely changed. And look at the surgeon. He's a man of status, of immense skill. He moves from bed to bed, examining his patients. He wears a frock coat, the same one he wears out on the street. It is stiff and black, not with starch, but with dried blood and pus from 100 previous operations. This coat is his badge of honor. It speaks of experience, of a man who is no stranger to the grim realities of his trade. He doesn't wash his hands between patients. Why would he? He can't see anything on them. He might wipe them on a rag hanging from his belt, a rag that has been used all day. He reaches for a sponge to clean your wound. It's a sea sponge, used and reused on countless other patients. It's simply rinsed in a bucket of cold, cloudy water that sits by the bed. That sponge is a teeming metropolis of bacteria, a perfect vehicle for transferring the infection from the man with gangrene in the next bed directly into your open flesh. His surgical instruments, if they were cleaned at all, were simply wiped and put away, ready for the next procedure. This wasn't malice. It was ignorance, a profound, deadly ignorance. These men were the best and brightest of their time, but they were blind. They were fighting a ghost. They attributed the infections to miasmas, to imbalances in the patient's constitution, to bad luck, even to a moral failing on the part of the sick. They never suspected that the killer was on their own hands, under their fingernails, on their proud, blood-stiffened coats. And so the cycle continued. A brilliant surgeon would perform a masterful operation, a procedure that should have saved a life. The patient would be wheeled from the theater alive, and then, days later, they would be dead. The more operations a surgeon performed, the more experience he gained, the higher his reputation soared, and paradoxically, the higher his death rate climbed. Because with every patient he touched, he became a more efficient carrier of the invisible death that stalked his wards. Before we see if there is any escape from this cycle, I want to take a moment. If you are finding this journey into the past a way to quiet your own mind, a way to find rest in these dark stories, please consider subscribing to The Dark Historian. It allows us to continue unearthing these forgotten histories. Your support means everything. Now, let us return to the ward, where hope is fading fast. Think of the patient's family, waiting for news. At first, the news is good. The operation was a success. Relief washes over them. But then, day after day, the reports become more grim. He has a fever. He is confused. The wound is not healing as we had hoped. They are watching from the outside as their loved one is consumed by something no one can name or fight. They see the surgeon's initial confidence fade into a resigned shrug. It is in God's hands now, he might say. But it wasn't in God's hands. It was in the water, in the air, on the instruments. The very place people went to be healed was the place most likely to kill them. The irony is staggering. The development of anesthesia, which we discussed before, had made surgery more possible. Surgeons could now take their time, attempt more complex, more invasive procedures that were unthinkable when the patient was a screaming, writhing wreck. They could delve deep into the body, removing tumors, repairing organs. It was a golden age of surgical innovation, and it was a golden age of post-operative death. With more surgeries being performed, the rates of sepsis, gangrene, and erysipelas skyrocketed. The operating theatres, once arenas of brutal but swift work, became the gateways to the slow, feverish decline in the wards. The surgeon's newfound ability to conquer pain had inadvertently made him a far more effective agent of infection. He was opening more doors for the ghost to enter. Imagine the psychological toll, not just on the patients, but on the surgeons themselves. To have the skill to save a man on the table, to perform a flawless technical procedure, only to watch him wither and die from an unseen force, a week later, over and over again. It must have bred a kind of fatalism, a grim acceptance of the odds. Surgery was a gamble, and the house, it seemed, always had the edge. They would speak of unhealthy hospitals, as if the buildings themselves were cursed. And in a way they were. They were cursed by an enemy no one had yet identified. The laudable pus, that symbol of a flawed understanding, continued to be the standard. A surgeon would look for it, hope for it, and his students would be taught to recognize it as a positive milestone. It was a collective delusion born of desperation. The alternative, the thin and watery discharge, was so terrifyingly final that they clung to the hope that its opposite must be good. It was a prayer in the face of a plague, a prayer that was rarely answered. The patient lying in that cot feels his strength leaving him. The world outside the ward, the sounds of the city, the memory of sunlight, it all begins to fade, replaced by the small, grim universe of his own suffering. His world shrinks to the stained ceiling, the face of the surgeon, the rhythmic breathing of the man in the next bed, and the relentless, burning fire in his own flesh. The search for a way to conquer pain had been a story of chemistry, of discovery, of bold experiments, but the battle against this new, silent epidemic would require a different kind of revolution. It would require a shift in thinking so profound, it would shatter the very foundations of medicine. Someone had to see the invisible. Someone had to name the ghost that haunted the surgical wards. But for now, in the middle of the 19th century, the ghost reigns supreme. It moves silently from bed to bed, carried on the hands of the healer. The age of painless surgery has arrived, but it has brought with it a quiet, feverish, and deeply intimate form of death. The operating theatre has been silenced, but the wards are now filled with a new sound, the quiet, rasping breath of the dying. And the story was far from over. A new battle was about to be joined, against an enemy that had, until now, remained perfectly hidden. That hidden enemy was not always an invisible microbe, a spectre of infection carried on a surgeon's unwashed hands. Sometimes the enemy was far more intimate. It was the enemy within, a slow, grinding, relentless pain that didn't arrive with the sudden violence of a musket ball, but grew quietly in the familiar spaces of your own body. It was a battle waged, not in a sprawling, blood-soaked field hospital, but in the quiet desperation of a bedroom, or in a dusty chair above a bustling city street. The grand theatre of surgery, with its audience and its celebrated, lightning-fast performers, was only one part of the story. For most people, the experience of the knife, or the forceps, or the saw was a private, lonely horror. It was a part of everyday life. Imagine for a moment the throb. It starts as a dull ache, a minor complaint you try to ignore. You chew on the other side of your mouth. You rinse with salt water, with clove oil, with whiskey. You pray. But it doesn't go away. The ache sharpens. It becomes a piercing, radiating agony that colonizes your jaw, your ear, your entire skull. Sleep becomes a distant memory, a peaceful country you can no longer visit. The pain is a constant, screaming siren in your head. It poisons your food, sours your relationships, and drains the color from the world. This is not a surgical emergency in the heroic sense. This is a rotten tooth, an abscess, a pocket of infection and decay festering deep in the bone of your jaw. And in a world before anesthesia, before modern dentistry, your options are few, and all of them are terrifying. Your last resort is the barber surgeon. You don't find him in a pristine clinic. You find him in a shop that smells of hair tonics, cheap soap and stale blood. The floor is covered in clippings of hair and the occasional dark, dried spatter. This is a man who shaves beards, pulls teeth, and lets blood, often in that order, with little more than a cursory wipe of his instruments in between. His sign outside, a red and white pole, is a symbol not of healing, but of a grim, necessary brutality. The red for blood, the white for bandages. You sit in the chair. It might be an ornate, heavy wooden thing, or just a simple stool. Your hands grip the arms, knuckles turning white. Your heart hammers against your ribs, a frantic drumbeat against the backdrop of the city's noise filtering through the window. The barber surgeon, perhaps wiping his hands on a stained apron, approaches you. He is not a monster. He is a tradesman. To him, your mouth is a problem of mechanics, of leverage. He looks inside, his breath smelling of onions or ale, and he nods grimly. He sees the swollen, inflamed gum, the blackened crown of the offending tooth. He knows what must be done. He turns to his tray of tools. You see them glinting in the dim light. Not the delicate, precise instruments of a modern dentist. These are tools of extraction, of force. There are the forceps, looking like brutal iron pliers, designed to grip and pull. And then there is the more dreaded instrument, the pellum or the dental key. Imagine a small metal rod with a handle at one end and a hinged claw at the other. It looks like an antique corkscrew designed for a giant. The idea is simple and horrifying. The shaft is rested against the gum, the claw is hooked over the top of the tooth, and then, with a sharp, brutal twist of the wrist, the tooth is turned in its socket. Broken free, he tells you to open wide. Maybe an assistant, or even just a burly apprentice, stands behind you, ready to hold your head still. There is no gentle numbing injection. There is only the cold, hard reality of steel against enamel. He tries the forceps first. The metal scrapes against your other teeth as he maneuvers them into place. He clamps down. The pressure is immense, not on the dead part of the tooth, but on the living, nerve-filled root, anchored deep in your jawbone. He begins to pull, to rock back and forth. You feel a hideous grinding, a deep, resonant cracking sound that seems to emanate from the very center of your being. Pain, blinding, searing pain. It is a white-hot supernova exploding behind your eyes. Your entire body convulses, a purely animalistic response to unbearable agony. The apprentice holds you firm, but the tooth doesn't give. Its roots are deep, curved, stubbornly anchored. The crown, weakened by decay, shatters under the pressure of the forceps. A cascade of jagged, sharp fragments fills your mouth, mixed with the hot, metallic taste of blood. The pain somehow gets worse. The nerve is now exposed, raw, screaming. The barber surgeon curses under his breath. Now, he must go for the key. He has to dig out the broken roots. He pushes the metal shaft against your bleeding gum, positioning the claw. You taste the iron. You feel the cold pressure. He grips the handle. He looks you in the eye and tells you to be still, and then he turns it. The sound is indescribable. It is not a clean pop. It is the sound of splintering bone, the sound of living tissue being ripped apart. The roots fracture. The alveolar bone of your jaw gives way. It is a wet, sickening crack that you feel in your soul. He pulls, and a ragged, bloody piece of your own body comes free. But it is not over. He has to go back in for the other fragments, digging and scraping in the raw, open wound. Each touch sends fresh waves of torment through you. Your vision blurs. The world narrows to this chair, this man's grunting effort, and the all-consuming fire in your jaw. Finally, he is done. He packs the gaping, bloody socket with a piece of lint soaked in oil of cloves or some other pungent concoction. The bleeding is profuse. He hands you a rag and tells you to bite down. The cost is a few shillings. The relief, when it eventually comes, is profound. But it is replaced by a new kind of misery. The deep, aching trauma of your shattered jaw. The risk of infection in the open wound is immense. A broken jaw was a common complication. Sometimes the barber surgeon, in his haste, would pull the wrong tooth, or two teeth at once. You stumble out of the shop, back into the daylight of the street. The world seems impossibly loud and bright. People are laughing, haggling, living. They have no idea of the private war you have just endured. You hold the bloody rag to your mouth, tasting the iron and the cloves, and you know that you will carry the memory of that chair and that sound for the rest of your life. This wasn't a rare occurrence. This was dentistry. This was the price of a toothache for centuries, an experience so common, so universally dreaded, that it became a benchmark for pain itself. Before we witness how this private agony found its place in the most intimate moments of a family's life, I want to take a moment. If you are finding this journey into our shared, darker history to be a source of calm, or a way to quiet your mind before sleep, please consider subscribing to The Dark Historian. Every subscription helps us continue to unearth these forgotten stories. Now, let us return to the quiet rooms where life began, and where surgery often meant the end of all hope. The horror of the pre-anesthetic world was not confined to men and their trades. It found its most profound and tragic expression in the experience of women, specifically in the act of childbirth. For most of history, childbirth was a domestic affair, an event managed by women for women. Midwives, with knowledge passed down through generations, oversaw the vast majority of births. But sometimes things went terribly, terribly wrong. A baby too large, a pelvis too small. A baby turned the wrong way, an arm or shoulder presenting first. This was an obstructed labor, and once the midwife had exhausted all her skills, once hours had turned into days of fruitless, agonizing labor, a desperate choice was made. A man was called. The arrival of the male surgeon, the accoucheur, into the birthing chamber was a sign of utter catastrophe. It was an admission of defeat. It meant that a natural birth was impossible. The room, once a place of female solidarity and support, became a theater of brutal intervention. The woman at the center of it, exhausted, terrified, and in unimaginable pain after days of labor, was no longer a mother-to-be. She was a surgical problem to be solved, and the solutions were medieval in their cruelty. The surgeon's primary goal in this desperate situation was almost always to save the mother. The baby, tragically, was often considered lost already. The task was to remove the obstruction. The task was to remove the baby, piece by piece, if necessary. The instruments he brought with him were things of nightmare. The perforator, a long spear-like tool with a sharpened, triangular head, was used to pierce the baby's skull, releasing its contents and collapsing it. Then came the crotchet, a long, sharp hook. It was inserted into the opening made by the perforator, hooked onto a bone in the skull or jaw, and used to pull the baby out by force. Imagine the scene. A small, dimly lit room, heavy with the smell of sweat and fear. The woman lies on the bed, held down by her husband or female relatives, her cries having long since faded into weak, exhausted moans. The surgeon, working mostly by touch, blind, introduces these cold, steel instruments into the most intimate part of her body. There is no pain relief. There is only the continuation of the agony she has already endured for days, now magnified, sharpened, and given a hideous metallic edge. The family in the room can only listen. They hear the sickening sounds, the puncture, the scrape of the hook against bone. They witness the surgeon's grim, physical effort as he pulls, as he extracts what was once a source of hope, now reduced to a grim necessity for the mother's survival. It was a butchery born of desperation. The internal damage to the mother was often catastrophic. Tearing of the uterus, the bladder, the bowel. If she survived the initial ordeal, the shock and the blood loss, she faced an almost certain death from infection. Puerperal fever, the great killer of new mothers, would sweep through her traumatized body. Survival was the exception, not the rule. And even for those who survived, life was often ruined. The internal injuries could lead to a fistula, a tear between the bladder or rectum and the vagina, resulting in permanent, uncontrollable incontinence. These women became outcasts, invalids, shut away from a society that had no way to help them and was repulsed by their condition. They had survived the surgeon's hook, only to be condemned to a life of shame and misery. There was another procedure, equally horrific, sometimes attempted to save both mother and child, the symphysiotomy. Instead of destroying the baby, the surgeon would attempt to enlarge the mother's pelvis. This involved taking a knife, and later a specialized saw, and cutting through the cartilage and ligaments of the pubic symphysis, the joint at the front of the pelvis. The idea was that the pelvis could then be pulled apart, creating the extra inch or so needed for the baby to pass through. The surgeon would make an incision. He would feel for the joint with his finger, and then he would cut. The woman, fully conscious, would feel a blade severing the very architecture of her body. She would hear the grating of a saw against her own bone. The pain is beyond imagination. It is the pain of being deliberately broken. If the baby was delivered alive, and if the mother survived the blood loss and the inevitable infection, she was often left permanently crippled. The pelvis, now unstable, would never heal correctly. She would be unable to walk without pain, condemned to a life of chronic agony and disability. It was a choice between two different kinds of hell. This was the reality that lurked behind the closed doors of homes, rich and poor alike. The joy and hope of childbirth were shadowed by this ever-present, terrifying possibility. Every woman knew the risks. Every family dreaded the moment when the midwife would shake her head and send for the man with the bag of iron tools. This was not the clean, heroic surgery of the battlefield amputee, celebrated for his stoicism. This was a secret, hidden horror wrapped in the intimacy of family life. It was a pain that was endured in whispers, behind drawn curtains, a visceral trauma that shaped the lives of generations. The pain was not an abstract concept. It was a defining feature of the human experience, as common and as inescapable as the rising of the sun. It lived in the abscess of a tooth and in the strained agony of the birthing bed. It was the great equalizer, touching the king in his palace and the farmer in his field with the same merciless impartiality. The science of the day could map the stars and weigh the mountains, but it stood utterly helpless before the simple, biological fact of agony. Surgeons were not cruel by nature. They were pragmatic. They worked within the horrifying limits of their time, wielding their knives and saws as the only weapons they had against death. They learned to steel themselves against the screams, to work faster, to see the body not as a feeling person, but as a machine of flesh and bone that needed mending. But even they were haunted by what they had to do. The famous surgeon John Hunter admitted that the operation was a humiliating spectacle of the futility of science. The screams from the operating theatre, the grunts of pain from the dentist's chair, the desperate cries from the birthing room, they formed a constant, terrible chorus in the background of life. A chorus of accepted, unavoidable suffering. For centuries, no one even thought to question it. Pain was simply a part of the bargain of being alive, a tax levied by God or by nature. But a change was coming, a subtle shift in thinking. A few lone voices, physicians and chemists, began to look at the world differently. They saw the suffering not as a divine sentence to be endured, but as a chemical and biological problem to be solved. They began to experiment, to tinker with strange gases and chemical compounds, searching for something that could stand between the surgeon's knife and the patient's nerve. They were looking for a key to unlock the gates of oblivion, if only for a few precious minutes. They were searching for a way to silence the screams, and in their quiet laboratories, a revolution was beginning to stir, one that would change the very nature of what it meant to be human. It did not begin with a thunderclap. It began as a whisper, a quiet thought in a quiet room, the kind of change that could alter the very fabric of human experience rarely announces itself with trumpets and fanfare. Instead, it starts with observation, with a question, with a lone individual noticing something that everyone else has been seeing for years, but failing to truly understand. The answer to the age of agony was not hidden in some arcane text or a lost formula. It was being passed around at parties for fun. Think of it. A drawing room in the early 1800s. The flickering gaslights cast long, dancing shadows on the walls. Men and women, dressed in their finest, gather not for a concert or a poetry reading, but for something far stranger. A traveling showman, a self-styled chemist, stands before them with a curious apparatus, a bladder usually made of silk or animal intestine filled with a sweet-smelling, invisible gas. He calls it nitrous oxide. He calls it laughing gas. One by one, volunteers from the audience step forward. They hold a tube to their lips and inhale deeply. And then, the change. A slow smile spreads across a man's face, then erupts into uncontrollable, booming laughter. A proper woman begins to dance a clumsy, giddy jig, her bonnet askew. They stumble, they weave, they speak nonsense. They are euphoric, uninhibited, completely removed from their normal, staid selves. The audience roars with delight. It is a spectacle, a thrilling, harmless diversion. Sometimes, in their giddy state, a volunteer would fall. They would crash into a chair or trip over a rug, striking a shin against a hard wooden table leg with a crack that should have brought tears to their eyes. But it didn't. They would simply pick themselves up, still grinning, and continue their strange, joyful dance. They felt nothing. The next morning, they might discover a deep purple bruise, a gash on their leg they had no memory of receiving, and they would marvel at the strange power of the gas. But that was all. A curiosity, a funny story to tell. For decades, this was the life of nitrous oxide, a carnival act, a parlor trick. No one saw the ghost in the machine. No one heard the whisper of what it was truly offering until a man whose life was defined by pain decided to pay attention. His name was Horace Wells. He was a dentist in Hartford, Connecticut, and every single day he came face to face with human suffering. You have to imagine his world. He wasn't a grand surgeon in a sprawling hospital. He was a local craftsman of teeth. His office would have smelled of oil of cloves and fear. His patients weren't stoic soldiers, they were his neighbors. Shopkeepers, mothers, farmers, people whose faces he knew. And he knew the look in their eyes as they sat in his chair, the dread, the tensing of every muscle as he approached with his cold steel tools. He was a kind man, a sensitive man, and the sounds of their pain were the soundtrack to his professional life. It wore on him. The grunts, the whimpers, the occasional, guttural scream that he had to force himself to ignore to do his work. He longed for a better way. In December of 1844, Wells attended one of these laughing gas demonstrations. He watched, just like everyone else, as the volunteers made fools of themselves. He probably smiled politely, but he was watching with different eyes. A local man, a clerk named Samuel Cooley, was under the influence of the gas. Stumbling about the stage, he ran his leg into a heavy wooden bench. He tore his skin open, a deep and bloody wound. Blood stained his trousers. Anyone else would have cried out, but Cooley just seemed confused, then smiled and sat back down. He hadn't felt a thing. Later, after the effects wore off, Wells asked him about it. Cooley looked down at his bleeding leg as if seeing it for the first time. He was shocked. He insisted he had felt no pain at all, and in that moment, for Horace Wells, the universe shifted. The laughter of the crowd faded into the background. The silly theatrics of the showman disappeared. All he could see was the connection, the astounding, world-changing connection that everyone else had missed. If this gas could prevent the pain of a deep gash on the leg, what else could it do? Could it prevent the pain of a tooth being pulled from its socket? The idea took root in him, an obsession. This wasn't a parlor trick. This was a miracle. He had to know. He had to be sure. But how? He couldn't risk it on a patient. Not yet. The only way to truly know was to feel it himself. Or rather, to not feel it. The next day, he made a decision of immense courage. He would become the first patient. He sat in his own dental chair. He asked the showman from the night before, Gardner Colton, to bring his bag of nitrous oxide. He asked a colleague, another dentist named John Riggs, to stand by with a pair of forceps. The tooth he chose was a troublesome upper molar, one that had been causing him pain for some time. Imagine that room, the quiet ticking of a clock, the soft winter light filtering through the window. Wells, his heart surely pounding in his chest, places the tube in his mouth. He breathes in the sweet metallic gas. He feels the familiar lightness in his head, the tingling in his fingertips. The world begins to swim. He gives a nod. Riggs steps forward, the cold steel of the forceps clamping down on the tooth. He pulls. A sickening crack of bone and root. In any other moment in history, this would be followed by a jolt of unimaginable agony, a white-hot flash of pain shooting through the jaw, into the skull. But Wells felt nothing. A dull pressure, a strange sensation of tugging, but no pain. He was conscious. He was aware. But the pain was gone. The tooth came free. Riggs held it up, stained with blood. Wells spat into a bowl, his mind reeling not from the gas, but from the discovery. It worked. It had actually worked. He is said to have exclaimed, "A new era in tooth pulling," but it was so much more than that. He believed he had found the end of surgical pain itself. His mind raced. This discovery was too important to keep to himself. It belonged to the world. It belonged to every suffering patient in every hospital, on every operating table. He had to tell them. He had to show them. Full of a righteous, burning certainty, he traveled to the medical capital of America, Boston. He arranged a demonstration at the most prestigious institution he could, Massachusetts General Hospital. In their surgical amphitheater, he would perform an extraction in front of the city's most respected surgeons and medical students. He would show them the key to a painless future. The room was packed. Skeptical faces looked down from the tiered seats. The air was thick with doubt. This was the hallowed ground of men like Dr. John Collins Warren, a giant in the field of surgery. And into this arena walked a humble dentist from Hartford with a bag of laughing gas and a story that sounded too good to be true. A medical student volunteered. He had a tooth that needed pulling. Wells was nervous. His hands trembled slightly as he administered the gas. Perhaps he was flustered by the intimidating audience. Perhaps the student, a large man, needed a higher dose. Perhaps the gas bag wasn't filled quite enough. We will never know for sure. Wells gave the signal. The tooth was pulled, and the student let out a cry. It wasn't a full-throated scream of agony, perhaps just a moan, a brief cry of discomfort. But it was enough. The spell was broken. The crowd began to jeer. They laughed. "Humbug," one of them shouted. "Fraud." The word echoed in the amphitheater. Horace Wells stood there, his miracle collapsing into dust around him. He tried to explain that the patient later admitted he felt almost no real pain, but it was too late. The verdict had been rendered. He was dismissed as a charlatan. He left Boston in disgrace, a broken man. He had held the salvation of mankind in his hands, and they had laughed it away. He would spend the rest of his short, tragic life trying to reclaim his honor, a ghost haunted by a success that no one believed. His story is a difficult one, a reminder that progress is not a straight line. Before we see how his idea was eventually proven right, if you are finding this journey into the past a helpful way to quiet your own mind, consider subscribing to The Dark Historian. It allows us to continue unearthing these forgotten stories. Now, let us return to that fragile moment in history when the dream of painless surgery had been born, only to be almost immediately extinguished. But the idea did not die with Wells's public humiliation, because ideas, once they are born, have a life of their own. They can lie dormant, they can travel in whispers, and sometimes The same idea can be born in two places at once. To find the other cradle of this revolution, you have to travel far from the hallowed halls of Boston, down to the sleepy, dusty town of Jefferson, Georgia. There, another man was watching another party. Dr. Crawford Long was a quiet, unassuming country doctor, and in his part of the world, they didn't have laughing gas parties. They had ether frolics. Young people would gather, soak a handkerchief in sulfuric ether, and take turns inhaling the fumes. The effects were similar to nitrous oxide, a state of giddy, drunken euphoria. And just like with the laughing gas, Dr. Long noticed that these young people would injure themselves while under the influence and feel no pain whatsoever. The same connection that Wells had made, Long made as well. But his personality was entirely different, where Wells was an evangelist, desperate to share his discovery with the world. Long was methodical, cautious, perhaps too cautious. In 1842, 2 full years before Horace Wells ever sat in his own dental chair, a patient named James Venable came to Dr. Long with 2 small tumors on the back of his neck. Venable was terrified of the pain of the knife, but he had been to ether frolics before. He knew its strange properties. He suggested to Dr. Long that perhaps he could perform the operation while Venable was under the influence of ether. Long agreed. In his quiet Georgia office, with no audience, no fanfare, he placed an ether-soaked towel over his patient's face. Venable breathed deeply. He drifted into a stupor. Dr. Long took his scalpel and, with a steady hand, excised one of the tumors. Venable didn't flinch. He didn't move. He felt nothing. It was the first recorded surgical operation using an inhaled anesthetic in Western medicine. It was a moment that should have shaken the world, but it didn't. There was no announcement, no journey to Boston. Dr. Long, ever the careful scientist, performed a few more minor operations using ether over the next several years. He wanted to be absolutely sure. He kept meticulous notes, but he didn't publish his findings. He didn't tell the world. And so his monumental discovery remained a local secret, locked away in a Georgia doctor's ledger, while the rest of the world continued to scream. The stage then returns to Boston. It returns to the shadow of Horace Wells's failure, because in that jeering crowd at Massachusetts General Hospital was a man who had not laughed, a man who had watched his former partner's humiliation with a complex mix of pity and ambition. His name was William T.G. Morton. He was a dentist like Wells. He had even been Wells's student for a time. He knew Wells was no charlatan. He believed in the fundamental idea that a gas could be used to prevent pain. He just thought Wells had chosen the wrong gas and the wrong stage. Morton was a different kind of man than Wells or Long. He was driven. He was hungry for fame and for fortune. He saw the immense potential, not just for humanity, but for himself. He began a relentless search for a better agent, a more reliable substance than nitrous oxide. He spoke with a prominent chemist, Dr. Charles Jackson, who suggested he try sulfuric ether, the same substance Crawford Long was using in secret hundreds of miles away. Morton was not a man for half measures. He began to experiment, first on insects, then on the family dog. He watched them fall unconscious and then wake up unharmed. Finally, like Wells before him, he knew he had to try it on himself. One evening he shut himself in his office, held an ether-soaked handkerchief to his face, and inhaled. He described a feeling of floating, of his limbs growing numb, and then nothing. He awoke some minutes later, groggy but alive. He knew he had found it. Ether was more potent, more predictable than nitrous oxide. This was the key. He developed a special glass inhaler with a sponge inside, a device that would allow him to control the dose far more effectively than a simple bag or towel. He was a showman, a promoter. He knew he couldn't just announce his discovery. He had to prove it, and he had to do it in the one place that mattered most. The place where the idea had been so cruelly shot down before. He petitioned the senior surgeon at Massachusetts General Hospital, the very same doctor, John Collins Warren, who had presided over Wells's disastrous demonstration, for a chance to try again. He wanted to demonstrate his new method for preventing pain during a major operation, perhaps out of curiosity, or perhaps because the memory of the screams still echoed in those halls. Warren agreed. The date was set. October 16th, 1846. The place, the surgical amphitheater that would one day be known as the Ether Dome. The patient was a young man named Gilbert Abbott, who had a large vascular tumor on the side of his jaw. The room was filled once more. The same tiered seats, the same skeptical surgeons and students. They had seen this show before. They were expecting another failure, another humbug. The appointed time came and went. Morton was late. Dr. Warren, impatient, looked at his pocket watch and turned to the audience. As Dr. Morton has not arrived, he said coolly, "I presume he is otherwise engaged." He picked up his knife, ready to begin the old way, the way of pain. But then the doors to the amphitheater swung open. A flustered William Morton rushed in, apologizing. His instrument maker had been putting the final touches on his new inhaler. He was ready. A heavy silence fell over the room. All eyes were on Morton as he approached the patient. He held the glass globe to Gilbert Abbott's mouth and nose. "Breathe deeply and calmly," he instructed. Abbott obeyed. For a few minutes, nothing happened. Then, the patient's body relaxed. His eyes closed. His breathing became deep and regular. Morton looked up at the surgeon. He nodded. "Dr. Warren," he said, his voice steady despite the weight of the moment. "Your patient is ready." Warren looked at Morton, then at the still form on the table. He was deeply skeptical. He picked up his scalpel. The polished steel caught the morning light. He leaned over the patient and made the first deep incision into the tumor on the man's neck. The crowd held its breath. They leaned forward in their seats. Every person in that room was waiting for the inevitable. The gasp, the tensing of the muscles, the sharp, piercing scream that always came. And what came was silence, a profound, unearthly silence. The patient did not move. His face remained peaceful, as if in a deep sleep. Dr. Warren paused, his knife held aloft, staring at the patient in disbelief. He made another cut, and another. Still nothing. The operation continued. The tumor was carefully dissected and removed, all in this strange, dreamlike quiet. The only sounds were the soft clink of steel instruments and the surgeon's steady breathing. It was as if the very laws of nature had been suspended within the four walls of that room. When the last stitch was in place and the bandages were applied, Gilbert Abbott began to stir. He slowly opened his eyes, looking around in a daze. Warren leaned in close. "Did you feel any pain?" he asked. The young man shook his head. He said he had felt a faint scratching sensation, like a dull blade being drawn across his skin, but there was no pain, no agony, no terror. Dr. John Collins Warren, a man who had built his entire career upon the grim necessity of swift, brutal, agonizing surgery, slowly straightened up. He turned to the stunned, silent audience. His voice, filled with an awe that bordered on reverence, broke the stillness. "Gentlemen," he said, "this is no humbug. The silence in that room was more than just the absence of a scream. It was the sound of a new world being born. It was the sound of a promise, whispered at parties and in quiet offices, finally being shouted from the rooftops. For the thousands of years that humanity had taken a knife to living flesh, pain had been the loyal, cruel companion of the surgeon. On that October morning, for the first time, the surgeon worked alone. The age of agony was over. The quiet revolution had finally begun. But the story of the men who started it was far from over. For them, the silence that followed their discovery would soon be filled with the bitter sounds of jealousy, greed, and a fight for credit that would destroy them all. That silence, the one that follows a great discovery, is never truly empty. It's filled with echoes, echoes of what came before the screams, the pleas, the frantic sounds of a body fighting its own salvation, and it's filled with the faint, dissonant whispers of what is to come. For the men who chased this silence, who hunted it down and gifted it to the world, that quiet was a curse. It was a space where their own demons could finally be heard. Jealousy, pride, a desperate, clawing need to be remembered. A discovery meant to end physical agony would birth a new kind of suffering for its creators, a psychological torment that would follow them to their graves. And the world, for the most part, would never know. It would only know the gift, not the price paid by the givers. To understand that moment, that hinge point in history, you have to go to a specific room on a specific day. October 16th, 1846. The place is the Massachusetts General Hospital in Boston. The room is the surgical amphitheater, a place that would one day be known as the Ether Dome. Picture it. A semicircular space with steep tiers of wooden benches rising up towards a domed skylight. The light that filters down is pale, clinical, illuminating a small, stark operating theater at the center. It's a room built for watching, for learning, but mostly for witnessing brutality. The air itself is thick with history. It smells of carbolic acid, of old blood that has seeped into the floorboards, of unwashed bodies, and the metallic tang of fear. The benches are filled with men. Surgeons in their dark coats, their faces stern and impassive. Students younger, their expressions a mixture of morbid curiosity and academic focus. They have all seen surgery before. They have all heard the sounds, the saw grinding against bone, the sickening slice of the scalpel through flesh, and above all, the screams, the raw, animal cries of a conscious human being taken apart. It is the soundtrack of their profession, a necessary, terrible music. Today, there is a different feeling in the room, a heavy skepticism. They are here to see a spectacle, but most believe it will be a failure. They've been promised miracles before. They remember the story of Horace Wells, the dentist from Hartford, and his disastrous demonstration of laughing gas right here in this very city. The patient had cried out. Wells was laughed out of the room, called a charlatan, his spirit broken. So when another dentist, a former partner of Wells named William T.G., Morton makes an even bolder claim. The medical establishment is not just doubtful, they are disdainful. The surgeon for the day is Dr. John Collins Warren. He is 78 years old, a giant in his field, co-founder of this very hospital. He has seen it all. He has performed countless operations while his students and colleagues held down the writhing patient. He has operated with a clock on the wall. His speed a mercy, his efficiency a legend. He does not believe in magic potions or easy fixes. He believes in a sharp knife and a steady hand. He has agreed to let Morton try his mysterious new vapor, but his face, etched with the wisdom of 1,000 agonizing procedures, shows no hint of optimism. He is here to get this over with, to expose another fraud and get on with the real, bloody work of healing. And then there is the patient. His name is Gilbert Abbott, a young man, a printer, with a vascular tumor on the side of his neck. It's not a life-threatening procedure, which is precisely why Warren chose it for this experiment. But it will be painful, excruciatingly so. He is brought in and placed in the wooden operating chair. He looks up at the sea of faces staring down at him. A specimen under glass, he can feel their doubt. He can feel the cold dread of the room. He knows what is supposed to happen next. He has braced himself for the restraining straps for the moment the first cut is made. But first there is a delay. Morton is late. The minutes tick by. The skepticism in the room hardens into impatience. Dr. Warren, a man not known for his patience, glances at the clock. He turns to the assembled audience. As Dr. Morton has not arrived, he says, his voice dry, "I presume he is otherwise engaged." It is a dismissal, a public rebuke. He picks up his scalpel, ready to proceed in the old way, the only way he knows, the way of pain. Just as he is about to begin, the doors to the amphitheater swing open. A flustered William Morton hurries in. He apologizes, explaining he was delayed making last-minute adjustments to his apparatus. It is a glass globe with 2 openings. Inside, a sponge is soaked in a liquid he has cryptically named Lethian, after the river of forgetfulness in Greek mythology. He is hiding its true nature. It is sulfuric ether. He hopes to patent it, to become rich and famous from his discovery. This secrecy adds another layer of suspicion to the proceedings. What is this substance? Is it safe? Warren simply nods, his expression unchanged. "Well, sir," he says, his voice betraying no emotion, "your patient is ready. The challenge is clear. Proceed. Show us your trick." Morton approaches Gilbert Abbott, his own hands lightly trembling, though no one can see. Everything is on the line. His reputation, his future. The future of medicine itself, though perhaps even he doesn't fully grasp the weight of it. He holds the glass inhaler to Abbott's face. "Breathe deeply and calmly," he instructs, his voice a quiet counterpoint to the tense silence of the room. Abbott does as he is told. He breathes in. The sweet, cloying scent of ether fills his lungs. The audience leans forward. They watch his eyes. They wait for him to struggle, to cough, to cry out. But he does not. He continues to breathe. His body, which had been rigid with fear, begins to relax in the chair. His eyelids flutter, then close. After a few minutes, his head lolls to one side. He appears to be in a deep, peaceful sleep. Morton looks up at the surgeon. He nods. "Dr. Warren," he says, "your patient is ready." The room holds its collective breath. This is the moment. John Collins Warren, the old master of the swift, brutal cut, steps forward. He holds his scalpel, the steel glinting in the pale light from the dome above. He places the blade against Gilbert Abbott's neck. He makes the first incision. Silence. Not a twitch, not a murmur, not a flicker of an eyelid from the patient. The only sound is the whisper of the blade as it moves through tissue. The surgeons and students on the benches are frozen. They stare, mouths agape. This is impossible. It defies everything they know about the human body, about the nature of pain. The nerves should be screaming. The body should be convulsing. The patient should be shrieking, begging for it to stop. But there is only a profound, unnatural quiet. Warren continues his work. He is no longer rushing. The clock on the wall is forgotten. For the first time in his long and storied career, he can be a surgeon, not just a butcher. He can be meticulous, precise. He dissects the tumor from the surrounding tissue with a care and deliberation that was never possible before. The minutes stretch on, each one a testament to the miracle unfolding in the center of the room. The entire operation is performed in this bubble of impossible peace. When he is finished, when the last suture is in place, Gilbert Abbott begins to stir. Morton removes the inhaler. The patient's eyes open. He looks around, dazed, as if waking from a simple nap. Warren, still struggling to process what he has just witnessed, leans in close. He asks the question on everyone's mind. "Did you feel any pain?" Abbott looks at him, his voice clear. "No," he says. "I felt a slight scratching sensation, like a dull hoe being scraped across my skin." A wave of understanding, of shock and awe, washes over the amphitheater. A buzz erupts from the benches. Whispers turn into excited chatter. They have just witnessed the dawn of a new age. They have seen the monster of surgical pain slain before their very eyes. Dr. John Collins Warren, the skeptic, the pragmatist, the man of science, straightens up. He turns away from the patient and faces his astonished audience. He, the man who was ready to dismiss this all as a fraud just minutes before, utters the words that would echo through medical history forever. "Gentlemen," he announces, his voice filled with a reverence no one in that room had ever heard from him before. "This is no humbug." And with that, the world changed. The news of what happened in the Ether Dome on that October morning did not just spread, it exploded. Letters and newspaper articles carried the story across America and then across the Atlantic on the next steamship to Europe. Within weeks, surgeons in London and Paris were performing their own painless operations, replicating Morton's success. It was a revolution that happened almost overnight. Hospitals, once houses of dread and agony, began to transform. The operating theatre, for centuries a place of barely controlled violence, became a place of quiet, methodical healing. Surgery itself was reborn. Procedures that were once unthinkable, that were too complex and took too long to perform on a conscious patient, were now possible. Surgeons could now venture into the great cavities of the body, the abdomen, the chest, the skull itself, without the tyranny of the clock and the horror of the patient's suffering. The very foundations of medicine shifted beneath their feet. Before we follow the dark, tangled path of the men who claimed this discovery, take a moment to rest in that quiet amphitheater. If these stories of the past help you find your own peace in the present, consider subscribing to The Dark Historian. It allows these journeys to continue. Now, let us return to that silence and the men who would soon fill it with their shouting. For Gilbert Abbott, the young printer. His part in the story was over. He was the first person to pass through the fire of surgery and not be burned. He was the vessel for the miracle. He would live a long life, forever known as the man who slept through the dawn of a new era. His experience was one of pure, unadulterated relief, a private gift of peace. But for the men who gave him that gift, peace would be the one thing they would never find. Even in that moment of ultimate triumph, the seeds of their own destruction were being sown. Morton's attempt to disguise ether as lithium, his desperate grab for a patent and a fortune, immediately muddied the waters. It cheapened the discovery, turning a humanitarian breakthrough into a commercial enterprise. And it opened the door for others. Charles Jackson, Morton's former mentor, the eccentric and brilliant chemist who had first suggested Morton try ether, was incensed. He immediately claimed that the discovery was his, that Morton was merely his technician, the hands that carried out his intellectual work. His voice was loud, and his reputation in the Boston scientific community carried weight. And what of Horace Wells, the man who had first had the vision, who had tried and failed with nitrous oxide? When he heard that his former partner Morton had succeeded where he had been humiliated, using a different gas, something inside him shattered. He saw his dream, his legacy, stolen. He began a frantic campaign to claim his own priority, to prove that he was the true father of anesthesia. His obsession would grow, consuming him utterly, and far away, in the small town of Jefferson, Georgia, a quiet country doctor named Crawford Long read the news from Boston with a sense of profound injustice. He had used ether to painlessly remove a tumor from a patient's neck back in 1842. 4.5 years before Morton, he had done it first. But he had never published his findings. He had never announced it to the world. In the quiet humility of his rural practice, he had held the key to ending centuries of agony, and had never thought to turn it. The silent revolution was over. The war had just begun. The great gift to humanity, this profound and beautiful silence, was now a bone to be fought over by hungry dogs. The world had been given a reprieve from pain, but the men who delivered it were about to enter their own private age of agony, one from which they would never, ever wake. Their discovery promised a peaceful sleep to the patient on the table, but it was a peace that none of them would ever know again. Their names would be tied together for eternity, not just by their shared moment of brilliance, but by the bitter, tragic, and deeply human ugliness that followed. The quiet of the ether dome was the calm at the very center of a storm that would rage for decades and drown them all in its fury. And so the storm raged. A discovery that promised to banish pain from the world instead brought nothing but pain to the men who claimed it. Horace Wells, his reputation in tatters, spiraled into depression and addiction. In a final, desperate act, he anesthetized himself with chloroform one last time, to feel no pain as he ended his own life. A quiet, tragic end for the man who first dreamed of a painless world. Charles Jackson, the brilliant but paranoid chemist, spent the rest of his years in a relentless, obsessive crusade to prove he was the sole discoverer. He wrote letters, he filed patents, he accused everyone of theft. The obsession consumed him, twisting his mind until he finally broke, spending the last 7 years of his life in an asylum, a ghost haunted by a single idea. And William Morton, the man who stood in the ether dome, the man who held the flask and made history, he died penniless. He poured every dollar he had, every ounce of his energy, into fighting for the patent, for the recognition, for the fortune he believed was his due. He chased it to his grave, collapsing from a stroke in New York City, a man broken by the weight of his own monumental achievement. It's a bitter irony, isn't it, that the birth of anesthesia, a gift meant to bring peace and relief, was so violent. Its pioneers, these flawed, ambitious, deeply human men, were devoured by their own creation. They gave humanity a miracle, and in return, it gave them ruin. They looked into the face of a god and were blinded by the light. But their story, their tragic, personal story, is just a footnote, a dark, sad postscript to a much, much larger tale. Because while they fought and clawed and destroyed each other over who owned the key, the door they had unlocked was already swinging wide open. And what came through it changed everything. To truly understand the scale of that change, you have to let your mind drift back one last time. Back to the world before. The world we've been walking through together. Try to feel it. The cold, hard dread in the pit of your stomach, as you are told the only way to save your life is the knife. There is no comfort. There are no reassurances. Only a grim, stark choice. A swift, brutal agony or a slow, certain death. You walk into a room that smells of sawdust and fear. The floor is stained. The tools on the table are not delicate instruments of healing. They are tools of butchery. Saws, knives, clamps. They are designed for one thing, and one thing only: speed. The strongest people in the room are not the surgeons, they are the assistants. Their job is to hold you down, to be stronger than your terror, stronger than your agony. They are human restraints, their arms like iron bands, their faces grim and set. They know what is coming, and then the surgeon enters. A man respected not for his precision, but for his speed. Can he take a leg off in under a minute? Can he cut through flesh and bone before you bleed to death or your heart gives out from the sheer shock of the pain? That is the measure of his skill. He offers no gentle words. He is there to do a terrible, necessary thing as quickly as humanly possible. You feel the burn of the whiskey they force down your throat. It does nothing for the pain, not really. It is there only to dull your senses, to cloud your mind, to hopefully make you faint. Fainting is a blessing, and then it begins. Pain, blinding, searing pain. A white-hot explosion that consumes your entire world. There is no thought. There is no past or future. There is only this single, eternal moment of unbearable agony. Your screams are just a sound. They mean nothing. They are expected. They are the soundtrack to this ritual. The sawdust on the floor is there to soak up the blood, but it does little to muffle the sounds that echo in these halls. The sounds of human beings being torn apart while they are still awake. This was surgery. For thousands of years, from the Roman legionary field tents to the gilded hospitals of Victorian London, it was not a science. It was a desperate, bloody last resort. A controlled maiming in the hope of life. And the surgeons who performed it were haunted men, their dreams filled with the screams of their patients. They carried the weight of that suffering with them every single day. Now, let that world dissolve. Let the screams fade away. Imagine a new sound. Or rather, a lack of one. Silence. A quiet, calm, almost reverent silence. This is the sound of the world after. The world that Morton and Wells and Jackson and Long in their frantic, selfish, brilliant way, accidentally created. The operating theatre is no longer a stage for a gruesome spectacle. It's a sterile, peaceful space. The air is clean. The light is bright and focused. The tools on the tray are no longer saws and cleavers. They are fine, delicate, intricate instruments, designed not for speed, but for precision, for patience. The surgeon is no longer a butcher in a hurry. They are a scientist, an artist. Their movements are slow, deliberate, and careful. There is no rush. There is only focus. The clock on the wall is no longer an enemy, ticking down the seconds until a patient's body gives out from shock. It is just a clock. Time has been tamed, and you are the patient. But you are not fighting. You are not being held down. You are lying peacefully. A kind face leans over you. A calm voice tells you to breathe deeply, to count backward from 10. 10, you feel a gentle coolness spreading through your veins. 9, the bright lights above you begin to soften, their edges blurring. 8, the quiet beeping of the machines around you becomes a distant, lulling rhythm, like a soft and steady heartbeat. 7, the world outside this room, with all its worries and its noise, simply ceases to exist. 6, there is no fear. Only a profound sense of surrender, a feeling of letting go, a deep and trusting calm. 5, and before you can even form the next number in your mind, you are gone. You are adrift in a dark, silent, dreamless ocean, a place where pain cannot find you, a place of absolute peace. And in that quiet, sacred space, the work begins. This is the gift. This is the miracle. It's not just the absence of pain. It is the gift of time. With the patient still and silent, surgeons could finally stop racing. They could explore. They could learn. They could take a journey into the human body that was previously unthinkable. Before anesthesia, the body was a fortress. The skull, the chest, the abdomen, these were forbidden territories. To open them on a conscious patient was to guarantee death from shock. The surgeon could only work on the surface. Amputate a limb, remove a tumor from the skin, set a bone. That was the limit of their world. But now, with the patient asleep, the fortress gates were open. Surgeons could now carefully, painstakingly open the abdomen. They could repair a ruptured appendix, a condition that was once a certain death sentence. They could remove gallstones. They could treat ulcers. They could venture into the intricate maze of the intestines, finding and fixing problems that had plagued humanity for millennia. Entire fields of medicine were born in that quiet. They could open the chest. They could see the living, beating heart, a sight no surgeon before had ever witnessed. And with time, they learned to mend it, to repair its valves, to bypass its blocked arteries. The most poetic and powerful organ in the body was no longer a mystery. It was a machine that could be understood, and a muscle that could be healed. And most remarkably of all, they could open the skull. They could enter the brain. The very seat of consciousness, the source of thought and identity. They could remove tumors with millimeter precision, relieve pressure, and treat injuries that would have been unimaginable just a generation before. Think of it. Nearly every single major medical procedure you can name, every life-saving surgery that we now take for granted, was built upon that one single discovery. Organ transplants, joint replacements, cesarean sections that saved the lives of both mother and child, cosmetic surgeries that restore form and function after terrible accidents. All of it flows from that first public demonstration in the Ether Dome, from a simple, sweet-smelling gas in a glass flask. It transformed not just medicine, but our entire relationship with our own bodies. The body was no longer a source of inevitable betrayal and pain. It was something that could be understood. It could be repaired. It could be healed. Hope replaced dread. Before we reflect on the final echoes of this story, if these quiet explorations of history help you find rest in our modern world, please consider subscribing to The Dark Historian. It allows these stories to continue. Now let us return to that quiet room. That simple act of counting backward, it is a ritual of trust, a profound act of faith that we place in science, in medicine, and in the people who practice it. We close our eyes and surrender our consciousness, believing, knowing that we will wake up again, and that when we do, we will be better. We will be whole. How many millions of lives have been saved? How many billions of moments of agony have been prevented? The number is impossible to calculate. It is as vast and as countless as the stars in the night sky. The legacy of anesthesia isn't written in medical textbooks. It's written in the quiet sighs of relief in recovery rooms. It's in the faces of families reunited. It's in the children who get to grow up, the parents who get to see them, the grandparents who get to live full, long lives, free from ailments that would have once been a death sentence. The storm that consumed Morton, Wells, and Jackson has long since passed. Their names are now mostly footnotes, their bitter squabbles a cautionary tale about ego and ambition. But the world they created, the quiet, painless world they ushered in, remains. And perhaps that is the ultimate lesson, that sometimes the greatest gifts to humanity come not from saints, but from flawed, broken, ordinary people stumbling in the dark, driven by impulses they barely understand themselves. They may not have intended to change the world for the better. They may have only been chasing fame or fortune or the simple, burning need to be right. But it doesn't matter. It doesn't matter what drove them. What matters is what they left behind. The next time you find yourself in a hospital or even a dentist's chair, just listen. Listen to the quiet, the calm, professional hum of a place dedicated to healing. There are no screams. There are no sounds of struggle. There is only peace. That silence, that beautiful, profound silence is their true monument. It is a quiet testament, echoing through the decades, to a time when surgery was a waking nightmare, a reminder of the world of pain from which we have been delivered. It is a silence bought with centuries of suffering, a silence that was earned in the blood and terror of the operating theatres of the past. It is a fragile peace, a precious gift. So as you lie here now, in the comfort of your own bed, in the quiet of your own room, let your own breathing slow. Feel the gentle rise and fall of your chest. Feel the stillness of the air around you. There is no pain, there is no fear, there is only this moment, this quiet, this peace, a peace that our ancestors could only have dreamed of, a peace that was fought for in a war against pain itself, and the war was won. Let that thought comfort you. Let it soothe you. The world can be a dark and noisy place, but here now, you are safe. You are at peace. Let the silence hold you. Let the darkness be a gentle blanket, and allow yourself to drift, to sleep